Hey, everybody. Thanks for joining us. So today is going to be a little bit different than yesterday. I mean, we might do some processes, but today is going to be more of just talking about different kinds of conditions and really answering your questions about things in general and also about things specific to you. Like if you have an ache, a pain, a bad hip, a bad back, let's talk it out and get you on the right way to treat it. And, we can even talk about what techniques to use. But as you look at the booklet, let's just revisit a little bit of what we did yesterday so I can point some things out. So on the very first page, you see pain processing and spinal thalamic tract. That's the thing that we did yesterday where we did the brain, the spine, the brain and spine. If you want to add the health rays, it does make it a little bit more potent. So there's an A and B to it. But, yesterday we just did the one. And, keep in mind, like down at the bottom, it says you can use spagyric tinctures of either lemongrass, spikenard, or myrrh. Like instead of doing a process, how we're doing the inhalation on the brain, the spine, taking those things internally, the spagyric tincture being a little bit more potent than just taking the essential oil because it's got tincture and essential oil and different ways of extracting the plant. Energetically, it's much more potent and it's much more harmonizing to the body. And so you can do the whole process, or you can just cheat and just do the tincture, or you can do both. Right. And so like if you're in really chronic pain, you dig deep and you throw everything at it. But if you're just doing maintenance, you can do something where you just take something from time to time. Something like this I do actually relatively daily just because of all the accidents and things that my body's been through. And, I might go a little period without doing it, but I usually can tell. And so like over a week or two of not doing it, I'm like, ugh, I got to get back on it. Right. And so I don't always do the same thing though. Like I'll rotate between galbanum and then I use spikenard and then I got on a lemongrass kick and then I was hitting the myrrh pretty hard. Um, you know, you don't always have to keep doing the same thing, but if that's comfortable for you, you can keep doing the same thing. It's really something that's very adjustable to you. And so the thing that I like also where there's multiple options is like, say you're doing it with galbanum, what happens when you run out of galbanum? You're having a bad day, you reach for something else. Like you want to find something that works kind of in a similar way. And remember the spinal thalamic tract, when it's agitated, whatever your pain is, like doubles or triples, right? Just bottom line, like it will double or triple. So the more you keep this calm, for one, your body stays more relaxed, but two, pain goes from an 8 down to a 3 or a 4. Like it is pretty substantial. And so, a lot of times when we're talking things out in like Q&A on Tuesdays or something, and somebody says, I have this health issue or that health issue, a lot of times what I'll say is do black cumin, right? Because that's anti-inflammatory and helps push the body into more of repair mode. And then I'll say usually use galbanum, and then occasionally I'll say maybe myrrh instead. But the idea is you're helping the body to produce cortisone when you use a little bit with black cumin, more so with black Sylvester pine. But you're definitely reducing inflammation and you're calming down the spinal thalamic tract. And so whatever the condition is, will start calming down. And I'm going to give you an example. There was this gentleman, he was a student, I think he was in Houston, and he had done something where I think he was running or something, and he misjudged a curb, and he was like trying to jump up on the curb, but he jumped too soon, And so he started coming down and his foot hit the curb, and he broke his toe. Like, he broke his big toe. And I mean, it was like, ugh, it was huge. Like, he'd gone to the doctor and gotten an x-ray, and they'd put him in a cast. And by the time I saw him, it had been about 5 days prior. And I mean, his toe was all black and blue, and he kept saying, the pain is getting worse. Like, every day, it's not getting better, it's getting worse. And you know, it didn't look good. Eventually time would have healed that, but he was going to have an uncomfortable probably 3 or 4 weeks. And we put him on black cumin and galbanum, and he said almost instantly, within an hour or so, he said the pain was almost gone. And by the end of that first day, the toe, the inflammation in the big toe, because it was one of those casts where the toes were sticking out kind of. But he had wrenched his ankle, I think, as well. Didn't break anything, but it was still a thing. So just the little ends of his toes were sticking out. And you could already see that the inflammation had gone down probably 50%. And he goes, man, like, it feels comfortable. I'm going to be able to sleep. Like, life got a lot better. Now, that's kind of an extreme situation, but anytime you have like an acute situation where pain flares up, that could be a first thing that you go to, like, treat the spinal thalamic tract. And a little bit later, we're going to talk about the use of black cumin and Sylvester pine. And but that could work for any kind of pain. Like, it just helps the body feel better. It could be sharp pain, it could be achy pain, if like your joints are achy, any of these things, you could go to these couple of things, and it's going to help substantially. So.
And then someone's asking internal or external on the galbanum and black cumin.
So the black cumin, we'll just drop down to black cumin here in a second, but black cumin would be internal. The galbanum, you could do actually either way. You could take it internal, or you could wear it topical. The only thing that I would say about topical, you want to put 3 or 4 drops like on your wrist, and that's how I do it most times. Every once in a while I'll take some internal, but galbanum does have a little bit, it's like a weird cousin of frankincense. Like, you can kind of smell frankincense in there, but it's like frankincense that nobody talks to. It's a little bit of an acquired taste. And so when you're around people who aren't used to essential oils, it might be a little weird for them. So if that's the case, I would take it internal, just so you don't have to have weird conversations with people. But I just wear it topical, but everybody in my periphery knows that I either smell good or weird any given day. It's just one of the things. So let's drop down, because I do want to like tie together.
And what page are you seeing?
The spinal thalamic tract was page 1, but now we're going to jump down to page 6, number 11. So this is inflammation and cortisone production. And this is basically, you could use black cumin, you could use frankincense, ginger or turmeric would also work. I think all of those work, but I find that black cumin works the best. Other people have said sometimes ginger works a little bit better for them, or turmeric definitely is good. Ginger and turmeric I use more for like chronic conditions, but like if it's really acute, I tend to go black cumin. But you can experiment. The good thing about this also is all those oils are very inexpensive. Like, they're very cheap to use. They, a bottle is going to last you quite a while, probably a couple of months. And the black cumin is cheap, and it's a 10 ml bottle. So a lot of times you get 3 or 4 months out of it for like, what is it, like 12 or 15 bucks or something. I mean, it's a lot of bang for the buck. Sylvester pine is for the cortisone production. And basically, it's like your body's producing an anti-inflammatory. Like if you have a really bad injury that's chronic, a lot of times the doctor will give somebody a cortisone shot, like in an arthritic condition, for example. And that helps reduce the inflammation, helps reduce pain, and helps to make you more mobile or make you be able to use that part of the body. Well, that cortisone is something that your body produces. And so the use of Sylvester pine, just applied topically again to the wrists. The reason why you're doing the wrist is the skin is it will absorb through the skin really well, but there's not a lot of fat under the skin on the wrist, so it will hit the bloodstream really well. So on the inside of the wrist, on the temples or the tops of your feet, there's not a lot of fatty tissue. So the oil doesn't have to penetrate through the fatty tissue. It goes right into the bloodstream. And so those are great places to put something. So tops of your feet, the wrists, or the temples. But usually with Sylvester pine, I do the wrists. But you're welcome to do whichever you'd like. But the good indicator would be that something is achy. Like when something's really super achy, Sylvester pine could be something you throw at it, and a lot of times it will take the achiness out. Now, also, Sylvester pine is something that we use for somebody who potentially has frequency of urination or urgency to urinate, because part of that can be it works about 70 or 80% of the time, but part of it is that the nerves get a little bit inflamed, and sometimes they're a little bit compressed. And what happens when that happens, when there's a little bit of compression on some of the nerves in the urinary tract, is that it excites the nerves. So the urgency becomes more of an issue, right? You might have urgency and then you try to go to the bathroom and it's like, it wasn't that big of a deal. Like it wasn't like you had a full bladder that you needed to empty. It was like there was something in there, but it wasn't like 911, like your body's telling you. Right. So the Sylvester pine will actually calm that down somewhat. So anyway, uh, the lymphatic technique that we did, it's just kind of simply written out on number 2. These are all things that we've kind of talked about, and we talk about in the Q&A sometimes, but it's just written out for you guys. We did emotional tension, which is number 5 at the top of page 3. Sensory overstimulation is basically when the body starts feeling really super sensitive. You see this in like inflammatory conditions. You see this in like chronic fatigue, fibromyalgia, those kinds of conditions. And basically what happens is when the lymphatic system is backed up, it makes the sensory nerves fire much more rapidly, right? So instead of saying pain is a 2, it sends the impulses to the brain and says pain is a 10. And it's not necessarily what's happening in the body, it's just the nerves get like super excited and they start sending way more like information to the brain. So putting sage on the body is a way to calm these nerves down, or vetiver. Like if you put it on the body, the nerves will calm down, and so by doing that, it will also reduce pain.
And what is that number?
Number 4, sensory nerve overstimulation. The other thing that gets overlooked a lot with pain syndromes is your breath. And here right above that on number 3, we have bronchial spasms. Anytime the body has sharp pain, like sharp stabbing, tingling, you know, those kinds of pain, that's a nerve pain. And anytime that the body has that within a few days, usually it's within about 7 days, your body starts to develop bronchial spasms because your body's in fight flight, right? So your body being in fight flight, it starts to constrict muscle tissue. And in the respiratory tract, it's the bronchioles. So the breath becomes shallow, becomes rapid, and it becomes harder and harder to take a deep breath, and it becomes harder to exhale, right? And so we want to be able to go through and unwind this in a way. Now, I know we covered a bunch of techniques yesterday, but I do want to kind of cover this one as well. I've talked about it before, but it's always good to have a refresher. So let's have you pull out, be it frankincense, German chamomile, some form of hyssop, larch, anula, sitka, amivisnaga, or breathe easy, or bronchioles. If you don't have one of those, I can come up with like maybe a B choice or something, but these are all very strong A choices.
And if you guys are following in the workbook, we are on page,
The middle of page 2.
yeah, middle of page 2, number 3, bronchial spasms. I'll be posting them here in just a second.
So basically, like you could say almost everybody has somewhat a little bit of spasms in their bronchioles. You know, it's very rare that somebody doesn't have some sort of issue there. But when we have a lot of pain syndromes or we have a lot of anxiety, the bronchioles go into a really bad spasm. And for anxiety, a lot of times the bronchial spasms are causing the anxiety, right? And so, like if you look at pain syndromes, like after a period of time, the person starts to get like poor sleep and starts to get a little bit anxious. And part of it is what the pain does to the body, right? So we want to be able to unwind some of the effects that pain is having on the body. You know, it's not necessarily how you would treat the symptom, but when you have nerve pain and you treat the bronchioles, again, it's another time where the pain will usually reduce by at least 50% or so. And so using treatments for the bronchioles is just part of good, solid pain management. So one of the ways to go through and check to see if you have bronchial issues is you take a long, slow, deep breath through your nose, like, and then you hold it for a second, and then you exhale very slowly. You try to exhale slower than how you inhaled, right? Now, if you don't have bronchial spasms, you'll be able to control the breath and go, right? But if you take a long, deep breath and you have bronchial spasms and you go, okay, now exhale even slower than your inhalation, you'll go, like, and it's just done, right? Because you don't have control over the bronchioles. So the exhalation either goes out really fast or it's really chaotic. Like you'll go, you know, it'll bounce around. Like it won't be smooth and even. And so this impacts cognitive function. This impacts body tension. This impacts emotions. Like it will make emotions a lot more agitated. It will magnify stress and it will magnify pain, right? So we want to be able to go through and treat this in a way that's quick and easy, right? So any of these oils will work. German chamomile works really well. Larch works really well. Sitka works really well. Any form of hyssop. I mean, basically all the ones listed work really well. I go through phases where I have a favorite one when it comes to this. I think currently my favorite one is larch. For the longest time, it was Sitka. Then I had my hyssop years. You know, it's just one of those things where you rotate things around. But So this is what I'd like you to do. Like we're going to do the test. We're going to use the oils, and then I'm going to teach you a thing called pursed lip breathing. And then we'll use the oil some more, right? So again, take a long, slow, deep breath, hold your breath, and then try to let your breath out through the mouth as slow as you can. And then again, long, slow, deep breath. And then pay attention to how your breath is as you exhale. Is it short? Is it chaotic? Or are you able to do longer than the inhalation and very smooth? Right? So inhale a few times, exhale a few times, and check out your breath. It's not as good as unwinding the, yeah, you could not just unwind it again. Sorry. Somebody is asking if Naoli would work. It would work. It's not as good as the choices here, but it's a B choice. Like it would have an impact on the bronchioles. It's just the other things would work better. Yeah, but it would work. I mean, even lavender would kind of work, and even spikenard would kind of work. It's just they don't work as well as these choices. Yeah. Yeah. Okay, so we've checked our breath. You have one of your choices. And here we're just going to do inhaling before we do the pursed lip breathing, just to see how the oils treat you, right? So right off the bat, whatever oil you chose, first just start inhaling it, not even following a pattern. Take nice, long, slow, deep breaths. Taking nice, long, slow, deep breaths. And then just pause. And let's just see what happens. Like you're holding the oil away from your nose. You're letting it incubate for a moment. And now take a long, slow, deep breath. Hold your breath and exhale very slowly and see how your breath changed. or did it change? Okay, so now we're going to follow a pattern. So you're going to begin inhaling. You're inhaling through your nose, exhaling through your mouth, but your awareness is going to be on the throat, the center of your throat. Take nice, long, slow, deep breaths. You're still on your throat. You're taking nice, long, slow, deep breaths. Now, you're going to drop down to the bottom of your throat. So if you kind of poke around your throat at the bottom, between the two collarbones, there's this little notch right here, like this little, little indention, you could say. And you're wanting to put your awareness on that little indention. It's referred to as the sternal notch, right? So you're putting your awareness on that area. This is a great way to access the bronchioles energetically. Your awareness is there, and you're taking nice, long, slow, deep breaths. Maybe we could do it at lunch. You're on that throat minor, also referred to sometimes as the secondary throat. You're taking nice, long, slow, deep breaths. Now, move your awareness down to the front solar plexus, so that area below your ribs on your upper abdomen. Now move your awareness to the back solar plexus, the mid back area, below your shoulder blades. You're taking nice, long, slow, deep breaths. And then just pause and be still. Pause and be still. Just let it incubate for a moment. Notice how you feel. Notice your body. If you have pain in some area of your body, notice how that is right now. And again, let's check. So take a nice, long, slow, deep breath. Hold your breath and slowly exhale. Okay, so we're going to do a thing called the pursed lip breathing, right? So basically you're gonna do this breath to manually open up the bronchioles, right? So what you're going to do is you're going to inhale through your nose. Just watch me for a second. And then you're going to hold your breath, and then you're going to tighten up your lips except for a little tiny hole, right? Like in the center, right? So you're going to go, and then you're going to force that air out of that little hole. So the idea is you have to use a lot of force to get the air out. And that force is what manually opens up the bronchioles, right? And so just a heads up, it will make you a little tiny bit lightheaded when you do it. So after you're done, just let yourself kind of be still for a minute. Let everything like acclimate, and then we'll do it again. Okay, so let's do it together. So inhale, hold your breath, tighten up your lips, and then force the air out between your lips. And then just be still for a moment. Yeah, it feels good. Yeah. Okay, so inhale again, hold your breath, and then force the air out between the tight lips. Go ahead and exhale. Mm, mm. And then just be still, begin just inhaling the oil, not even following a pattern. Just start inhaling whatever oil you were using. Like, oh,
Yeah.
okay. So somebody was saying, a couple people said they were lightheaded, but one person was saying they get a little bit of a headache. I think that used to happen to you as well, right? Um, Sometimes when the bronchioles are in a good spasm, like that pressure will actually produce like a little temporary, like, my head doesn't feel good. But it's because the bronchioles are in such spasm. And a lot of times we don't know that they're in spasm. That's the thing, is they just, could be air quality, could be an illness, could be pain, could be, all kinds of things, stress. There could be all kinds of reasons why it's there. But yeah, the more you do this, the less that should happen. Like that. So that's kind of a little bit of an indicator. And if the breath is shallow, it will throw off the solar plexus, it will throw off the Ming Men, and it will throw off the forehead.
If I feel it's in spasm, I can do the long, slow inhalation, and exhalations are quite comfortable.
Oh, okay. Well, that's good then. Yeah. Okay, and let the oil go for a moment, and we're going to do it one more time. Inhale, hold your breath, and then force the air out. Mm. The breastbone. Mhm. Okay, so let's begin inhaling the oil again. This time your awareness is on the throat. We're going to follow through the pattern again. Nice, long, slow, deep breaths. Your awareness is on your throat. You're taking nice, long, slow, deep breaths. Now drop down to your throat minor, the bottom of your throat, that little notch between the two collarbones. Go to your front solar plexus. Now move your awareness to the back solar plexus. Your awareness is on the back solar plexus. You're taking nice, long, slow, deep breaths. That area below your shoulder blades on the back side.
Ah,
And then just be still. Just be still. Just let it incubate for a moment. Okay, let's just do a check. Take a long, slow, deep breath in, and then try to exhale as slowly as you can. Notice your exhalation and has something changed. Okay, so let's share experiences, ask questions before we start talking about the next thing. This is one that would be a real bread and butter thing to do for any sort of pain syndrome, especially nerve pain or arthritic pain. So let's go ahead and share or ask questions.
okay, go ahead, Miguel.
Hey, Miguel.
Maybe you didn't mean to unmute. Okay. Go ahead, Ralph, then Troy.
Hey, Ralph.
Hey, Greg. I have a question regarding what we did yesterday in this morning's experience. Can I ask that now, or do you
Yeah,
want me
no,
to?
go ahead, fire away.
Okay.
We're pretty casual with this one this weekend. It's all about chatting,
Yeah,
and so go for it.
yeah, and it's all related, I think.
Okay.
So we did such a good job of uncovering things yesterday that I got up this morning and the right side of my face is, I wouldn't say painful, but definitely uncomfortable.
Hmm. Okay.
And it seems to be centered around the right or the left eye socket, left side,
Okay.
not the right side.
Yeah.
And thinking back to yesterday where we were so good about doing direct application of marjoram and cypress,
Hmm.
and that was so good. I'm a little nervous about putting the marjoram and the cypress so close to the eye, and like you mentioned, that might be
So
a problem.
yeah, like I would agree with that, but the issue is actually not your eye. You're having referred pain pattern. So let me pull something up so I can show you a diagram.
Okay.
Um, so I'm sending this over to you right now.
I'm keeping an eye.
Okay, so she's gonna post this.
In chat.
Yeah,
Okay.
Yes, I'll do both. I'm sure it's a picture, Greg.
yeah, it's a picture.
Okay. So I'll post like a downloadable thing, but I'll also share the screen as soon as I get it.
Okay. Thanks.
Screen share.
Okay, so you see the red spots are potential referral areas for pain, and the darker they are, the more exaggerated. And um, it can be just like pieces of it, or it can actually even be more exaggerated. And so, like here, this is the sternocleidomastoid. So you see those little X's down the neck? That's
Yes.
actually where the problem is at, but it will manifest up in the head. So you might get issues at the top of the head, the back of the head. You can see on the deeper part, it goes in the ear. But a lot of times the thing that people call sinus pain is actually, it's either the sternocleidomastoid or it's trigeminal neuralgia. And
Okay.
so as much as you would treat the eye, you probably wouldn't get like like you'd get okay results, but like treating the neck is actually what's going to produce a much better result. And so, lantana would work, but you could put the marjoram on the neck. You could put spikenard or vetiver on the neck, especially those two like rope-like muscles that kind of come down from behind the ear. Like the
Okay.
more that you treat that, the more it's going to relieve stuff up in the face and on the head somewhat. And so, the around the eye, it's a sensitive area. In pain syndromes, you can go somewhat to the painful spot to help to resolve it, but usually the problem is somewhere else. So you can resolve it somewhat, but the idea of like what we did last weekend with the vibrational healing, and we were working that catabolic state, that's basically working the trigger point blends. And the idea is just to calm that down in the whole body so that it becomes easier to treat like specifically on a site. And so you could do a version of that with just inhaling the trigger point blend and following that part in that out of that class, but then still like treat the neck, like still go through and just put things that are like antispasmodic. And sometimes I'll even use something like terebinth or pine on the neck just to like kind of keep cleaning up the tissue. um Lovage could work, but definitely like marjoram, vetiver, spikenard. And I find that like lantana works really good for the sternocleidomastoid, but sometimes I still rotate things, just because they all have their little thing that they do.
Yeah.
And like sometimes it's the like multi-causal approach that kind of will unwind it. So I would keep rotating some of those things. But part of it too is the sternocleidomastoid helps to elevate the rib cage when you're breathing. And so that's why we have it when we have sinus issues, is we're having a hard time breathing in through the sinuses. So the sternocleidomastoid has to work harder to elevate the rib cage. So if the diaphragm is tight, if the nose is stuffy, if the lungs are real congested, if there's tight muscles in the chest or upper back, like any of those things will make the sternocleidomastoid work a lot harder, including like lifting things and holding it in front of you. Like, say you had to pick up a bag of salt and you're, walking it up some stairs or something. That thing of holding the salt out in front of you strained the sternocleidomastoid. So anything like that will actually aggravate that, but you won't have pain in the neck. You're going to have pain up in the face and in the head, in the ear, like somewhere in there. So I would go through and treat the neck.
Okay.
Yeah.
Um, all right. So you say rotate the oils.
Yeah, I would
So is
rotate.
that like put some on, like
Yeah.
neat apply, wait
Yeah.
5 minutes, then neat apply the
No, I
next
would
one?
do one and then like the next day do a different one. Like I would like, today's my marjoram day. Tomorrow's my terebinth day. The next day is my vetiver day. Like I would just kind of do it like that. And you could do
Okay.
neat, as long as it's not something too caustic or something.
Mhm.
You could do neat, or you could put it like in an ointment or in a little bit of alcohol and just rub it on the area.
Yeah. Okay, good.
Yeah.
All righty.
Okay.
I
And keep
think,
me posted on that. Because that should resolve. That's one that should resolve pretty good. Yeah.
okay.
Yeah.
All right. I think that's going to answer it. Thank you.
You're so welcome.
And then go ahead, Troy, then Laura.
Hey, Troy.
Hey, good morning, Greg. So I think I'm basically piggybacking. I was in the same neighborhood as Ralph there.
Oh, with
I
the
have,
neck and the face?
yeah, I was like
Yeah.
laughing out loud
Yeah.
as you're describing
Yeah.
the motion that you would strain that with. I was like, oh, it's
Right.
basically what I do all day, every
Yeah,
day for a
exactly. I was just
living.
going to say that is probably your bread and butter move is, because you're moving so many things, you're just like, ugh, always doing that. And so, even when it's feeling good, I would say, when we're younger, like it doesn't have quite the impact, because the body's a bit more resilient. And it's not that age like makes it get worse, but it's like the wear and tear that happened in age. You know what I mean? You fell, you hit your head, you got into a little car accident, you fell down and conked like you whipped your neck a little bit, you have slept funny for a while. Like the other thing that can exaggerate that problem is sleeping on your stomach with your head turned to the side real hard. And so, for me, I love to sleep on my stomach. It's the thing that relaxes me. So, I know this. So I take a pillow and I prop my head up so that it's not twisted to the side, like it's not quite straight, because my face would be in the mattress, but I turn it just slightly, and then I use the pillow like on the side of my head, so it kind of keeps it propped in that position. Because as much as I've tried to not sleep on my stomach, it's not going to happen. Like I'll start off that way, and I wake up on my stomach. And so, uh, any versions of that, like you just keep doing maintenance on the neck because, it's the the thing with like the psoas, the diaphragm, and the sternocleidomastoid, they have a big impact on your overall like nervous system health for the body. Like if the body's in an agitated state, like one of the first things you do is you look at those three muscles. Like something's up usually with one of those three muscles or all three. And the more that you treat them, the more that the body is able to like relax. And so everybody has an issue with the sternocleidomastoid, the diaphragm, and the psoas. It's just to what degree. And so if you're already having some problems, I would just, constantly treat that area. It doesn't have to be like crazy intense treatment, but like maintenance or prevention. And so, another one that I like to do sometimes, just to mix it up is time linalool. Like I like to put time linalool. In the old days, I used to take time linalool and put a couple drops on the fingertips. And then one of the things you can do is just like stroke that muscle like really lightly. And the sensory stimulation of the skin in that area combined with the time linalool sometimes will relax that muscle. And so, you just go through and you do both sides. Usually you have one side that's worse than the other. Like it's not usually both sides doing it at once. You usually have like a good side and a bad side. And, it usually depends on injury or how you sleep or something like that. But if you've ever had a car accident where the head like whipped a little bit, you got a sternocleidomastoid issue. Like if you sleep on your stomach, sternocleidomastoid issue. If you're prone to lots of respiratory things or like asthma or something like that, sternocleidomastoid issue. Like I mean, honestly, almost everybody has some form of it. It's usually they don't recognize it, or it's not bad enough to where it causes them problems to address it, but it's still there. Yeah. I used to do this like in my very early days. I used to do this form of like physical manipulation, and it's kind of like what people call osteopathic manipulation here, but it's from Japan. And the very first thing that we would do, no matter what the condition was we treated the sternocleidomastoid, regardless of what the person complained of. Like that was always the first go-to thing. Eventually we'd look at the diaphragm, eventually we'd look at the psoas, but the very first thing you would address the sternocleidomastoid. Like that was the first step, regardless of the condition. Yeah.
Well, I've ticked off everything that you listed
Right. Right.
multiple
Yeah,
times.
I know.
I was
Yeah.
gonna ask you though, in relation to this,
Uh-huh.
if you can see, is that what is causing that like radiating pain kind of sensation that I experience so frequently on like the left side of the jaw and the left side of the head?
Very well could be. Like it could be some of that, like it could be also the jaw. And the other thing that I'd look at is the calves, like, making sure that the calves stay loose. Because it's not so much the gastrocnemius, the more superficial calf muscle, it's that deeper muscle. I think you say it like soleus or soleus. It's a deeper calf muscle, but when that calf is tight, the tendency is for the jaw to get tight and to even have some bruxing, grinding of the teeth. And with all your running and stuff, you'd be a little bit predisposed, just because the running, works those calves so much, but also the impact of hitting the ground also can be a little agitating to those deeper calf muscles. The other thing that deep calf muscle will do, it will cause an SI joint issue. Like, so if you're having a little bit of low back stuff on that SI joint, I would say you definitely have a soleus issue.
I think I do. I can
Yeah.
look that up, but if
Yeah,
you guys
I can post it for you here right now.
happen to have an image of it, and then what would I be? What oil would be
I
top
would use
for
things that are
rubbing in?
antispasmodic. I'm kind of digging the idea of using larch on that because it's so soothing to the overall nervous system and it's calming to the motor nerves. But I still will mix up and put like some marjoram there or some black pepper, things that are just antispasmodic. Um,
Okay, you just answered my last question then also.
so we're gonna post this picture.
And we'll do it the same way as before. I'll do a share in the screen and then I'll post it in the chat as well for you guys. Okay.
Yeah, you can kind of see like there's that area in the SI joint, like it feels like radiating pain. And so that's like low back, but like off to the side a little bit. As much as I've tried to treat that area topically in that area, usually the legs and the calves reduce that more than treating the site.
Sorry, he shared a little different way this time. So give me just a second. I'm gonna post the link to the place in the chat first, and then I'll get that over to you guys.
I did it the same.
It did a weird airdrop thing. Oh, there.
Oh.
I got this now.
Yeah, I shared drop on first. Sorry.
That's okay.
But I sent it to regular.
Yeah, I got it now. Yeah, we're
Yeah.
good. We're good. Just and do it that way. Be much easier for everyone.
Awesome. Thanks so much, Greg.
Yeah. You see, like, is your pain kind of similar to that?
I mean, yes, and
Yeah.
basically everything that I actually I feel it there a little bit, but I more consistently feel it like right around, I don't know, what is it, like L3 to 5 area.
Like real close to the spine?
Yeah, but also out like towards the kidneys too.
Okay. For that, I would probably also work the inner thigh and the outer thigh, like the IT band.
Okay. Yeah,
Yeah.
that's tight too.
Like
Yeah,
like
calf.
when those issues are there in the IT band and the inner thigh, part of what happens is the spine in that L area, 1 through 5. It will tighten up to try to stabilize the spine because of the issue down in the leg. And so as much as you try to treat that area, it'll feel better, but it won't feel great. Like, you know what I mean? It's like, but the more that you treat the outer and the inner thigh, the more that area in the lumbar spine lets go. Like it just will go, oh, we don't have to stabilize the spine. The IT band's in a good place. And so a lot of times the IT band is like it's going to be usually mid thigh, like, you know, so not quite at the top, not quite down by the knee, but that mid thigh area on the side of your leg is usually the hot spot. Again, it's a runner's thing. Like runners, cyclists, tennis players, basketball players. If you do a lot of stairs, hiking up and down mountains, like, you know, not just flat hiking, but you're climbing and then you're going down, and then you know, because the quads have to fire a little harder to stabilize, especially going down the hill. You know, going up the hill, they have to push to extend the leg, but coming down, they have to tense up to stabilize the leg as your weight is shifting going downward. Yeah.
And then with the treatment on the bands, sorry, Troy, don't
Mhm.
mean to, would it be the same?
Yeah, same thing. Yeah.
Same oils, anything antispasmodic.
Yeah, like anything antispasmodic. I do like terebinth for this. Like terebinth is very good when like tissues get really wound up. It's very good for detoxifying the lactic acid and the tension in the area. Um it will help to unwind it, but also from last weekend, how we did the vibrational healing, that part about the catabolic state. Catabolic state, another way of saying that is just trigger point activity in the body. And so I would say, you know, also do some work with that trigger point blend from that class, just so that you decrease the potential for trigger points in the whole body. And then it makes treating the spots much easier, like much, much easier. Yeah. Yeah.
And
Because
then,
the
sorry,
thing is like a lot of times, like when I was traveling with athletes, they would have issues like this, but they were not going to stop. Like you know, they would push through the injury. And I mean, that's most people. Like you have your shoulder thing or your neck thing, and you're, you know, it's at work, and it's like, okay, this sucks, but I still gotta work. I still gotta do the things that I gotta do. And these things, you can actually treat them even though you're staying active doing those things. Like you don't have to go like, I have to rest my legs, I have to rest my neck, you know, I need to not lift things. You know, it might take a little bit longer, but usually when I would travel with them, I would usually travel with them for like a week or two. And, you know, they would be performing every day, you know, regardless of the sport. And they would say at the end of those 2 weeks, they would be super tired and worn out from the performance, but their body felt better than when they started. And they would say, in theory, like every time I would feel way worse. But here, because we kept treating all the way through, you know, I would just evaluate their issues and then we would put treatment protocols in place. They would perform, they would be tired because they worked so hard, but they didn't have the aches, they didn't have the pains, they didn't have the spasms, they didn't have, you know, whatever issue it was that was keeping them up. And it's nice that you can treat it and not have to go, okay, I have to take 2 weeks off from not doing something because my neck is, you know, jacked up, or my IT bands are jacked up. You know, you treat it and you just keep doing the stuff that you're doing. So if you're hiking or running, I'd say keep doing it, but treat those areas so that it diminishes.
okay, yeah, because it's not really an option to stop. It's like I kind
No,
of have to have that play hurt mentality.
yeah, yeah,
Great, I'll do these things. Thank
yeah.
you so much.
You're so welcome.
And then go ahead, Laura, then Teresa.
Hey,
Hey,
Laura.
Greg. Actually, a lot of my questions were answered by both of the questions beforehand, but I do have a couple of things. One, with the Spadgeries, you gave a list of galbanum, spikenard, lemongrass, myrrh as some of your favorites. Do you take like one in the morning and one at night for a period of time, or and
Yeah,
rotate, or?
yeah, exactly. I would, most of them I do just like the dropper full, or I use the essential oil. Like, you know, the Spadgery has been a new evolution, and it is a bit more potent, and it makes it. I like it because you're getting the tincture and the oil, so you're getting a much broader spectrum of the plant, and so I find that I get better results and I don't have to treat it as aggressively as I would when I wasn't using the Spadgery. And so the only one I would say, like lemongrass, I would probably put in a little tiny bit of water and drink it, even though it's still a tincture, just because like lemongrass, if it can just be a little bit irritating to the stomach if it's not diluted somewhat. Like I can take the tincture fine, but I would say for most people, I would just dilute it a little bit. It would just make your tummy feel weird for like 15 minutes or so. Very mildly, but still, you don't even need that. But
Are there days that you would take all four of the tinctures?
if you're having a bad day, like if you were having a really bad day, yeah, I've done that.
Or
Yeah.
if you're just hanging out with me.
Yeah, you know, or you know, every once in a while, you know, I don't have many days where it's like a day off, but if I'm having a day off, I usually, you know, rest and I'll do a little bit deeper therapy on some of those things. And I would rotate through several of those. But you know, you might find one that's your favorite, and you might find that like rotating them. I would say, you know, do a couple of days of one and then do a couple of days of another. Like
Do you-
the two that I rotate through a lot is galbanum and then myrrh. And then, you know, I'm feeling pretty good about it. And like when I take the galbanum and the myrrh, I feel like, yeah, I'm just maintaining something. So whenever I don't feel like a little push to where I feel better, then I'll rotate to something else. And so then I started doing lemongrass and I was like, that made me feel even better. Like, you know, so the way that I rotate them is, of course, I want to maintain it, but I also want to have a little bump up and how I feel. And if it's not bumping it up enough, I know that it's maintaining something, but I still want to have an improvement because, you know, yes, I feel good, but it doesn't mean I couldn't feel better still. And so I'll keep rotating until I find that little magic combination.
Got it. Do you have a
Yeah.
Spadgery for black cumin?
Yes, black seed. Yeah. Yeah.
So, number one, I have a lot of inflammation with the arthritis in my knees,
Sure.
but I also have a young friend of my son's who has been diagnosed with arthritis, and he is in extremely bad shape. Would a black seed Spadgery
Yeah.
be something? What else would you?
I would right off the bat, I would put him on black seed. I would put him on probably galbanum and Sylvester pine right off the bat and let him do that for a little tiny bit. And then later today, we're going to talk about the different conditions. Do we know what kind of arthritis he has?
Yes, and I forgot.
In the hands and feet, or is it in his hips?
It's definitely in his hands and feet.
Yeah, so that's rheumatoid arthritis.
It's rheumatoid.
Yeah, yeah. So, I mean, every once in a while it can be psoriatic arthritis, but most often it's rheumatoid. And so, you know, later today when we're talking about it, there's like an auric program and a vibrational component. If they'll do that, great. But, you know, when you're dealing with somebody who you're just trying to get them to feel a little bit better and they don't have any background in this, you know, have them do those things that we just talked about and then apply joint relief ointment to the hands and the feet. And, you know, most times my favorite one was this old rancher when I lived in Santa Fe, and her hands were just, she could barely move them. And I brought her some ointment and I said, hey, just try putting this on. She goes, I've tried everything, nothing works. And she put it on and she was like, this isn't going to work. Don't be offended. And then she started moving her hands and she started going, it worked. And, because part of the issue, rheumatoid arthritis is autoimmune for one, right? But the other issue is there's so much like spasm and poor blood supply in the fingers and the joints that's why they get so stiff, and the bones are kind of wearing down, and so that's why the hands start getting kind of in funky positions. And so the joint relief will increase blood flow both to and from the area and reduce the spasms. So just that, it starts to increase range of motion and it starts to protect the joints. And so, I always kind of say this whenever we talk about arthritis, but like if I pinch my finger right here, like, and I pinch it just moderately hard, within 2 hours, this joint above, like if I'm pinching here, this joint up here starts to become pre-arthritic because of the poor blood supply. So the thing is with joints, you have this piece of cartilage that it's like a shock absorber, and it doesn't have its own blood supply. So when there's a spasm or poor blood supply to the area, that cartilage starts to dehydrate and it starts to break down, right? And so as soon as that starts to dehydrate and break down, it starts to become pre-arthritic and then eventually arthritic. So with that piece of information, as much as you can keep blood supply in the hands and the feet, like, as good as it can be, that degeneration of those joints is going to diminish and the pain will diminish. So you treat it internally to try to shift the state of the body, and then topically or symptomatically, you put something on the area so that the blood supply is improved, the cartilage gets hydrated, and the spasms are reduced so that the person can move it, and the movement also helps improve blood supply and everything. So you kind of start pushing it in the other direction.
Okay, I'm going to be very specific with this. If I get a black seed and a galbanum spaghery, would you have him do one a day of each?
So have the black seed, the galbanum's not in a spaghery, at least not yet.
Okay.
So you would get the essential oil of the galbanum, and I'd have him put a couple of drops in his wrist or take it internal. The black seed, I would have him take every day, like and probably even twice a day, but at least once a day. And then,
Tincture full.
yeah, a dropper full a day, like a dropper full. I mean, he could
Okay.
do 2 or 3, but it might be a push to get him to do 1.
Sylvester pine on the wrist,
That would be amazing.
and
He would feel so much better doing that.
and joint relief just on the hands and feet.
Yeah,
Ointment.
and get the joint relief and an ointment. That
Got
way
it.
it's just turnkey and ready to go.
And I could do pretty much the same thing for my knees, right?
Yeah, for your knees, you could do joint relief for your knees, but you also could do like blue healer, or because you could reduce inflammation in that area. So because if I remember right, your knees are bone on bone.
Yes.
So you could still do the Sylvester pine, the black cumin, the galbanum, and then instead of joint relief on the knees, I might go like blue healer, pain relief, inflammatory, like something like that. Yeah, because you're wanting to reduce the inflammation in that area, and those blue oils are still antispasmodic, but it's a little bit more specific to just reducing the inflammation. And when there's bone on bone, you're constantly generating inflammatory material. So you constantly have a potential for inflammation when a joint is bone on bone. So you just keep that area like disinflamed as much as possible, and you can stay active and it doesn't generate the inflammatory material quite as much.
Excellent. Thank you.
You're so welcome.
And go ahead, Teresa.
Hey, Teresa.
Gonna try to get myself off mute. So, are you familiar with kinesiology?
Yes.
Okay, so I'm a kinesiology practitioner, and in one of the protocols, they'll have a reactive like muscle group release where one muscle is taken over for other muscles in the body and
Right,
is
right.
holding things in place.
Right.
And I realized between working what we did yesterday and today, I still have my gluteus maximus is holding.
Mhm.
That's a part of that hip discomfort. It's that
Okay.
that connector. Um, we just need to say you can take a break and go on holiday. You don't have to do that anymore. I could see the trauma as childhood.
Sure.
And I can see exactly where it happened, and what happened, physical and mental and emotional. What would there be anything in addition to what we talked about yesterday, which was mugwort and helichrysum, and then it was also, I think it was, if I wrote down correctly, it was the vibration secret, vibration and larch. Would there be anything that you would
Yeah.
recommend that would just say, hey, take a break, let it go?
So the thing with that, like when you start to have like a dominant like muscle that takes over a muscle group, like you were
Yep.
saying, um, you know, that's starting to be in the vein of like what you would call like a muscle imbalance.
Yep.
And it's you know, sometimes it's a one group is opposing the other group, and you know, there starts to be imbalance that way. But like whenever you start to have a like a dominant muscle or a dominant leg, you know, like for example, like with the hip, a lot of times when people have issues, if you pay attention, you stand on more of one leg than the other. And so then that makes that hip fire a little bit more than the other side. And so I would say all those things that we talked about yesterday, but because you have a dominant muscle or a dominant, like, you know, grouping in an area, is spikenard, valerian, myrrh, um, vetiver somewhat, but usually spikenard, valerian, or myrrh, or that blend balance,
Okay.
and put it on that area as an ointment. You
Okay.
could actually do a body tonic as well. I kind of like the idea of an ointment just because the ointment does like a slower release and keeps it more localized, where
Okay.
body tonic kind of like it goes into that tissue, but then it starts circulating through the whole body, where the ointment keeps it really specific. And
Okay.
so like a daily application of that will actually relax that muscle and allow those other muscles to start functioning like they should.
Okay.
Yeah. Yeah.
And how many drops? Because I have balance and I have one of your blank ointments. How many drops?
So in an ounce, I would put 30 drops of the
Okay.
oil in. I mean, you don't have to go that strong, but that would be the maximum dosage that I would do. And for something like that, I would go maximum. But
Okay.
you know, you could probably get away with 20, but you know, if a little's good, more is a lot better.
Yes. I've been carrying this around for quite some time, so I'm
Yeah,
happy to.
usually it's a very long-standing issue. It's a very common thing, like in athletes, people who have had injuries, you know,
Yeah.
you know, even when we do like repetitive things, you know, whatever that might be,
Yeah.
repetitive actions can do it, but injuries can do it. And like you said, like sometimes psychological things were traumas that we went through, we hold it in our body in particular ways, and then the body just never lets go of it.
Sure. Yeah. I know this was a combo. We don't do things
Yeah,
half measure. It was,
right.
you know, it was actually physical, mental, and emotional, probably even spiritual at some level. If I don't have an ointment and I have a Thera lotion that's
Yeah, that would work.
blank. Okay,
Sure. Yeah,
great.
that would work.
All right, super. Thank you very much, Greg.
You're so welcome. And I think we're checking, is there another question? I think, hold on for just a second. Thank you.
And go ahead, Troy, then Sonia. Oh, yeah, Troy, then Sonia.
Hey,
Hey Greg, I just wanted to circle back around. I forgot to ask I was just curious how the feet relate to that, since so much of what's happening is like with the I band, IT band, hamstring, calf. Like, i- is there something I could do?
yeah,
or
so one
happening
of
in
the
the feet?
things that I would look at is I mean, always unwinding the feet is good. Spikenard on the feet, taggets on the feet is always good for taking the tension out of the feet. But there's this thing called Morton foot structure, and it's basically like more people have it than don't have it. And basically, it's like let me see if I can find a picture of it. I just want to see if this is an issue for you. So we're gonna post this. This is an exaggerated version. So basically, Morton foot structure is the first metatarsal, you know, the bone in the foot is a little bit further back. So the big toe is a little bit further back. So then it makes the weight bearing joint the second metatarsal or the second toe joint. And that will throw off like the calf and the back and all of that stuff. And so more people have it than don't have it. And I sent a second picture so
Oh,
you
did
can
you?
kind of you can see like how the big toe is a little bit further back. Um, so that's one way to look at it. But you see in the second picture, there's
I'll have to get that up. Give me a sec, guys.
yeah.
Oh, it didn't show up well at all. It's weird.
Yeah, it's one of those ones that's
Yeah, give me a sec, guys. That doesn't show up well for you. Let me see. I can maybe change the format to have it visible, but it's gonna take a minute.
oh, well. But basically on the side of the toe, the side of where the big toe knuckle is, under the second toe, and on the outside of the foot by the pinky, there's like these little calluses that happen. Do you have calluses in that area on either one of your feet?
Yes.
So it means you have more foot structure. And so I mean the way to treat it, like for most people have it and it's not really a big issue. But when you stand a lot, when you run, when you hike, when you play tennis, you know, all these things, because you're pushing the body and the foot more, it can begin to exaggerate and cause problems in the calf and up in the low back. And so one of the ways that it compensates is you can either put like a orthotic in where it just builds up a little tiny bit, like a little bit of a pad underneath the big toe knuckle. Or the other thing that we used to do like a long time ago is we would take out, like, you know how the shoe has the insert, or you can put an orthotic in, and under the big toe, you actually cut that area out so that the big toe like kind of drops down. And so either way, you either put padding under it or you allow it to drop down. And a lot of times it will resolve a lot of tension in the feet, calf, and the low back when you do have that structure. And so you're also a little bit more prone to like a bunion as you get older with Morton foot structure, because the big toe knuckle, instead of being relaxed like that, will start to kind of like go like that. You know, it kind of gets this like little crampy look to it. And then over a period of time, the toe will start to move inward and it starts to produce the bunion. Yeah.
Great, thank you.
Yeah. But one of the treatments for that, as far as essential oils are concerned, is like taggets. Like if you rub taggets on your feet, a lot of times the effects of having the Morton foot structure is reduced. And then you could also use like spikenard. And I mean, there were several athletes that we did that instead of doing the orthotics, and it worked. It worked. Like we didn't have to do anything else. Before I discovered taggets, we would do the orthotic thing. You know, I would send them to go get orthotics, or we'd pull their shoe out and I'd cut the little hole in their shoe, you know, the insert in their shoe, because it doesn't have to be very much. It's just like, you know, little tiny bit, but it shifts your weight bearing joint. And so it makes the leg more stable, you know, because it being that the second joint becomes the weight bearing joint, it's like muscles have to compensate up the leg and in the back to stabilize that, because the balance is off just a little tiny bit. It's just a little bit, but it's enough when you're pushing your body. You know, if you were just working in an office and having to go up and down a flight of stairs to get to your office, it wouldn't be probably a big deal. But, you know, you have very manual, you do a lot of manual labor for your work, and then you're very active and everything. So any sort of issue like this becomes magnified or exaggerated. And like I said, I remember reading a study that I think it was like 65 or 70% of the population has a Morton foot structure on at least one foot. It's not always on both feet. It's usually just on one, but it can be on both. But it's just a weird anatomical like variation that, you know, can cause some issue. But if you treat it on a regular basis, yeah, it should not be an issue. Yeah.
And you guys have a larger size, like a 10 or 15 mil of the taggets?
I can do whatever size you want. Yeah.
Okay.
So send an email and I can send you a gallon drum, you know, if you want.
Okay. Thanks so much. Appreciate
So,
it.
And then go ahead, Sonia, then Ralph.
hey, Sonia.
My primary care doctor, who's really into natural and
Uh-huh.
alternative stuff, she sent me a breathing test that he wanted me to do, and it's for hyperventilation or overbreathing, and it's overbreathing is defined as an abnormally rapid, deep breathing. The outcome of overbreathing is loss of carbon dioxide, which, like oxygen, is important in regulating health. Carbon dioxide is required to maintain optimal blood pH, maintain respiratory drive, and regulate release of oxygen from hemoglobin. It helps. Carbon dioxide combines with water to form form carbonic acid, which lowers pH, which helps hemoglobin release oxygen to tissues. Conversely, low carbon dioxide causes less oxygen release in our bodies. And he cites a book by Teresa Hale, Breathing Free, the Revolutionary 5-Day Program to Heal Asthma, Emphysema, and Bronchitis, and Breath, the New Science of a Lost Art by James Nestor, who says modern research is showing that making even slight adjustments in the way we inhale and exhale can jumpstart athletic performance, rejuvenate internal organs, halt snoring, allergies, asthma, and autoimmune disease, and even straighten out scoliotic spines. And the test is you relax and you're breathing comfortably. At the end of your breath, you pinch your nose with your fingers and you put a clock with a second hand in front of you, and you keep your mouth closed and you count how many seconds you can last before you need to inhale again. And it says, don't push it. The accuracy of the test depends on you stopping before you reach the threshold of discomfort. And so then you count the number of seconds before you have to breathe again. If it's 50 to 60 seconds, you're in excellent health. If it's 30 to 50, you have a hyperventilation concern. And if it's less than 10 seconds, you have a serious hyperventilation problem, and it's associated with asthma and other health problems. And my neurophysical therapist, she tried it and on all her patients, and they all were hyperventilating. So she did blood tests to see the amount of oxygen in the blood, and they were all low, including her. And so, it emphasizes the importance of breathing correctly. I can send you the test.
So I would be curious. Like, in mystical practices, we do something like that where it's not like holding your breath on the inhalation, but you're holding your breath on the exhalation.
Because you hold it at the end of the exhalation.
Right.
And count the.
Oh, interesting. So,
seconds.
I find that Angelica is helpful for that.
Angelica.
Like you can inhale it, but I would probably say internal.
Okay.
Yeah.
Anyway,
I've never found it to be like you do it and immediately you notice a difference, but like over a period of time, it does seem to shift that component, because that is I've never heard somebody talk about therapeutically, but in mystical practices, we do almost the same thing where you hold your breath on the exhalation and then you see how long you can go. And, one of the things that happens when you can't, like you said, when you can't go very long on after the exhalation, is it's usually associated with like anxiety and fear syndromes.
In this, it's saying 9 out of 10 have this hyperventilation problem.
Okay. Yeah, please send me the links. I would be very curious. Yeah.
Okay.
Yeah.
And then go ahead, Ralph, and then we'll see if we have time for any chats.
Sure.
Hey, Greg. I was looking in my inflammation kit, seeing as how we're talking a lot about inflammation today. And one thing you haven't mentioned yet is rhododendron oil.
So rhododendron
what's rhododendron pointed at?
It's for clearing out the spine.
Okay.
So rhododendron works. There's another oil called catrafate. Catrafate works for that. And then the blend stagnation. Stagnation would also, and actually from the chakra class, the spine blend would work for that as well.
Okay. So if I have something that calls for spine blend, I might be able to choice would be rhododendron.
Yeah.
Great. Thank you.
Yeah, you're so welcome. Yeah. Rhododendron is a little weird fact. is the national flower for Nepal. Like it comes out of Nepal, but it's like they consider it like, I don't know that they consider it sacred, but they consider it very special.
Okay. All right, so we have a few minutes before we jump into our lunch and Sunday session. So let me go here to some of the questions. Let me see. Sorry. Okay, so just as far as like sharing,
Mhm.
right after we did it, someone said they're much cleaner and smoother now.
Oh, very nice.
So their ones feel much cleaner and smoother. Greg was saying to use Sylvester pine for inflammation. Should we do this once or twice a day?
At least once a day. Honestly, when I'm feeling inflamed, I do it like 3 or 4 times a day. Twice a day would be good, but you're just putting it on your wrist. So a lot of times what I do is I put it on the coffee table, and every time that I'm sitting in front of it, I put a few drops on, and hopefully I get it twice a day. Sometimes I get it more, sometimes I get it less, but so it has an impact on like long-term inflammation, and especially when an area is achy. The black cumin is good about just reducing the inflammation point blank, but like when the body is starting to get achy, you know sometimes just a normal anti-inflammatory, it will work, it just takes longer. So the body's elevated production of cortisone actually will help offset some of that achiness. And so things like arthritis or like a chronic injury, or your joints are achy, Sylvester pine, you start using it and it's like all of a sudden the joints don't ache like they normally would. So you could go crazy with it.
Would it be advisable to mix spagyric spikenard and spagyric galbanum?
We don't have a spagyric galbanum yet. We're trying to source like good raw material of galbanum, and I found some, but it's just really super expensive. So I'm trying to find it at a better price so I can keep the price down. So, but you could use galbanum on the wrist or galbanum internally, and then take spikenard internally in the spagyric form. And yeah, that'd be really good on the body.
And that answers that next question, which was, and take it internally. So.
Yeah.
Someone's asking, can you take joint relief internal?
No, joint relief is meant to be topical. Like, even inhalation, it will work, but it's more of a topical application. I wouldn't take it internal. Yeah. No, it wouldn't really benefit you, and there's some strong oils in that. So I would say just topical on the area.
The spagyric spikenard internally for severe back pain?
Sure. Yeah. Is the back pain achy, or is it sharp? Or is it both?
Well, it's actually namaste.
Hey, how are you?
Good. It's actually my super, and he has very severe back pains. Physically, he's a lean, small kind of fellow, and he's a super because I'm guessing he does a lot of lifting and super stuff.
Yeah.
But he said he's been to the doctor multiple times and they cannot find anything wrong with his back. So recently, a couple of weeks ago, I put him on the Vetiver on the shins, hamstrings, and biceps, and the mugwort on all the joints, and that works really well for him. But I'm thinking, I'm just thinking further.
Yeah, boy, that was a good choice to start with that. I would say I would like galbanum or spikenard internally, or even lemongrass. You could just do the oil. It doesn't have to be the spadry version. So that internal, but I would also say do something to open up his bronchioles, like larch or hyssop or something. And it's like if he's had chronic pain like that, his bronchioles are in spasm. It's just mechanics. Like
Right.
it is there.
The
And
his up
so
decumbens.
yeah, hyssop decumbens, and actually, another one that's good in the herbal world, because I know you have your foot in there as well. Lobelia. Lobelia would work.
Oh, I got that from you. Lobelia
Yeah,
scratchy.
yeah.
Yeah.
Lobelia will relax the diaphragm and relax the bronchioles, and it doesn't take very much, like a capsule, maybe 1 to 2 times a day, and that usually is enough.
I was
And
thinking in the last class you just gave us the spikenard ointment. I was going to
yeah,
throw in the taggets with that for his feet.
oh, that would be amazing. Yeah,
Yeah,
that would
that's
feel
what I was
super
gonna
good.
do.
So it's his low back,
I think it's his whole back.
his whole back.
Actually,
Yeah.
I didn't ask that question. I did not ask that question.
So that I with it being like potentially the whole back. So anytime that the bronchioles are in spasm, that means the diaphragm's tight. And when the diaphragm's tight, the little multifidi, like the little muscles that run up and down the spine, clamp down. And so they have a direct correspondence. If the diaphragm's tight, the multifidi are tight. If the diaphragm is relaxed, the multifidi are relaxed. And so I would say open up the breath. And by opening up the breath, the spinal muscles will relax. And if you want to accelerate that, marjoram applied to the spine, or at least the parts that he can reach, be it neat and a body tonic, an ointment, however he gets it on. But just putting marjoram even close to the spine will start to relax those muscles as well.
okay.
Yeah, like it's an old time thing. I have several chiropractors who do this. They were where they make like a spray or a little liniment, and they'll rub it down the spine on their patient, and then they'll let it cook for about 30 seconds, and then they say it makes the adjustments much easier and much deeper. And so in medical aromatherapy, the idea is if you put marjoram on the spine will begin to self-correct. Like if there's things that are out of place, the spine will start popping, and might not be in the first application, but if you do it kind of consistently, the spine will start to correct itself.
So should I put some marjoram in one of your body tonics and spray it
Yeah,
on?
I would, yeah, give him a body tonic, or make a little small version and test it on him. Just take some like alcohol, and I'm usually doing like 20 or 30 drops per ounce. And so, like, it doesn't have to be quite that strong, but I would make it kind of strong and then have him slap it on and see how it feels.
Right.
So we need to jump over to the Astara thing, but let's pick up this conversation and any other conversations right after lunch. It's all going to be Q&A and me chatting about different conditions. So have your questions ready, and we'll see you at 1:30.
Thank you.
Take care. Hey, everybody, let's come on back. And I think we're handling questions from people.
Yep.
So let's go ahead and,
Go ahead, Zakia.
hey, Zakia.
Yeah, I had another client who has insomnia.
Okay.
I couldn't get her to answer direct questions about what she thought might be contributing. So I was wondering if I gave her the same spikenard ointment, maybe for her feet, maybe with vetiver or something else for insomnia.
That's a good place to start. Insomnia, like you said, has a lot of different reasons, and a lot of times people don't know why. But one of the things that I would do is first ask her, which you probably already have, like, is there like a pain issue, a pain syndrome of some sort? Is there stress or anxiety? She can still have insomnia, even though those things might not be there. But things to start with are like spikenard, marjoram. The sleep support has some things in it that can be helpful. Even tarragon can be helpful. And so, a lot of times insomnia can just be an imbalance in the autonomic nervous system. So tarragon and marjoram both help to stimulate more vagal tone. And if you go down, like in the booklet to page 10, there's a thing called autonomic function / balance. And it's basically using like lemongrass as a pattern where you do the front heart, back heart, forehead, back head, and then reverse it. If she'll do the pattern, a lot of times that can be helpful. But if not, just taking some of those things internal should be helpful. Tarragon internal, marjoram internal, applying it to the body, or just even without a pattern, just taking long, slow, deep breaths. A lot of times that will help to resolve some of it.
It's funny you say that about the pattern, because I had a separate question, like for people who have never taken a class with you and don't know
Yeah.
anything about patterns.
Right,
Is
right.
it okay to suggest they do that?
Yeah, if they'll do a pattern, I would throw a pattern at them, but like sometimes with the general public, just getting them to take long, slow, deep breaths is like usually the first phase. And then after that, you can start having them directed on their, towards body parts or towards energy centers. So I would say evaluate who you're dealing with
Right,
and how involved they'll be. And my thing is, like, I always try to give them something that's like within their threshold. Like, so if they're not into any of this stuff, just inhaling something or taking something internally is about all you're going to get. If
right,
they're kind of into it, you could say, okay, inhale and maybe put your awareness on your feet or on your lungs, something like that. But if they're somebody who's like a peer with you, one of your friends or something who's into all this stuff, give them a pattern and let them run with it. And so I would say figure out where they're at and then
yeah.
from there. Yeah.
Because another thing I was going to try to contact you and discuss, right?
Mhm.
So I have another client who her issues are low self-esteem. She
Mhm.
cannot speak for herself. She wants to speak and walk in her own truth, right? And
Mhm.
so those are all solar plexus issues. So what I was gonna ask you, what might be applicable, appropriate, was to possibly have you send me a kit. We just did a class on divine healing,
Mhm.
and that, from my reaction, was so powerful in terms of feeling my own selfness. I don't know what that means.
Sure. Yeah, yeah. I get you.
I was going to possibly ask if I can send her a kit and
Sure.
walk her through the patterns, if that might help her with that issue.
Yeah, you're talking about the vibrational healing, that class? Which
I
class are you
think
talking?
it was, I think, divine healing or divine self. I think it was a 1-day Sunday.
Mm. It was the
Oh, yeah,
one.
divine self.
Yeah, it was the pre.
That was the precursor to the vibrational healing. Yeah, I would totally do
Oh,
that. Yeah, I mean that's kind of the public version of vibrational healing. That's
oh,
what
okay.
that's what that meant, it was meant for.
So that would be good for her.
Yeah. Oh yeah, totally.
Okay, so I might just have you send me that kit,
Yeah.
and just, rather than have her take the class and sit, which she's never done before,
Right.
I would rather support her through that,
Yeah, sure.
maybe in a Zoom, and just have her purchase the kit.
Yeah, yeah, that's perfect. And if we need to, if I remember right, that has a bunch of 5 ml bottles in it. We can make a small, like, little 2 ml
Right,
kit
right,
size
right,
thing,
right.
so to reduce the price.
Okay,
So
I will do that.
yeah.
Thank you.
We could, like, and I know you already know this, but like we can make, like, even if it's like a big kit like that or big bottles, we can make the little small version so that it's something that you can get to your clients and they don't have to jump through all the hoops of
Right, right,
the
right,
class or the big bottles or something.
right.
So,
That'll
we'll
be
do
great.
whatever you want.
Great, thanks so much.
You're so welcome.
And just on that note, email us whether, you know, obviously Zakia, email us, let us know exactly, but for anybody, like,
Yeah.
same thing.
I mean, Zakia already knows it. We were kind
Yeah,
of saying that
yeah.
for other people, but yeah.
Okay. Yes,
Yeah, I
I
mean,
will do that.
Zakia, like you've already been doing that stuff with people, but like
Right,
I was just
right.
letting other people know. Yeah.
Thanks so much. I will.
Yeah. Yeah.
And then I'm gonna try to go back to any earlier questions as well. And the thing I was gonna let everyone know is, you know, if you have any questions, feel free to still unmute yourself, raise your hand, type into the chat. And so I just want to make sure. Okay. Okay, so what is the best for chronic tension in the calf?
Chronic tension in the calf. You know, I like the idea of the larch for that, like larch as a body tonic. Inhalation would also have some impact, but putting that on the body because I mean, of course, there can be an injury, but a lot of times that is also a sign of like a neurological disruption of sorts. And it can cause other issues, not just pain and everything, but you know, checking the calves, for example, is one of the things they do when they're evaluating cardiovascular issues. You know, the doctor will jam their thumb in the middle of the calf and ask you how tender that is. And, you know, if it's real bad, you know, you kind of wince, and doesn't mean you have a cardiovascular issue, but it's one of the things that like they look at. And it's because the tension in the calf is an indicator of disruptions in the nervous system in the body. And so like it can cause like a rapid heart rate, elevated blood pressure, not necessarily cause it. It's a reflection of it is a better way of saying it. And so just because you have tension in a calf doesn't mean you have those other things, but the calves do have a pretty profound effect on your overall like physiology. So the idea of the larch is that the larch kind of calms down the body. It opens up the bronchioles, and it is one of the best things for calming down and soothing the motor nerves, like the nerves that make your body move and you know take action. And so it's tied to the voluntary part of the nervous system. And so it calms things down in ways that other things don't. And I like it for that. You know, like a lot of times when we're looking at the voluntary part of the nervous system, a lot of times we're talking about more of the sensory component. Like I feel pain, I feel this. They're overexcited, they're, you know, whatever that might be. But the motor nerves can actually cause a problem. They're just harder to treat. And so the idea of going through and applying larch to the torso and the legs, actually over a period of time after a couple applications, you notice that the tension in the calves and those areas are starting to reduce. You know, you still can put ointments and things on there with like marjoram and pepper and things like that. But when the nervous system is really wound up, you'll find that it helps, but it doesn't help massively, right? So you need to, you know, all the techniques that we're talking about is talking about shifting the state of the body. And so treating spasms would be more of treating a symptom. So I would say do both. Treat the state of the body with the application of larch, and then treat the symptoms with things that are antispasmodic. So things like marjoram, black pepper, you know, basil, you know, things that we know are antispasmodic. Vetiver, spikenard, things of that nature. Yeah.
Do you ever put larch on the skin neat in addition to breathing it in?
Oh yeah. Neat, body tonic and an ointment. I find that the body tonic actually works better than the ointment, but definitely neat. Like if I don't have a body tonic with me, like sometimes when I travel, I just do neat. Like I put several drops on the chest and abdomen, and then I'll put some in my hand and then just rub it into the calves. It feels good, man. It feels so good. So you could do any version of that. Yeah. Putting it on the skin without even breathing it actually starts to unwind the bronchioles as well. You know, most substances that unwind the bronchioles do not do that. You have to inhale it. But larch starts, as soon as it hits the skin, like it starts to unwind the bronchioles. So
What was the tincture or spadgery used to help sleep?
well, there's a tincture called sleep support that is something that you take internal. You could also use a really good one is the lady slipper slash valerian. And lady slipper is an old school herb. It was really more prominent back at the beginning of the 20th century, like the early 1900s. And they would use it for sleep issues, but they would also use it for treating things where the body got really agitated or the person's not sleeping very well. You know, back then, heroin and cocaine were something you could buy at the pharmacy. So they were treating a lot of addiction. And when people go off those things, their body's very agitated. And so lady slipper was one of the herbs that you would use to treat that. And so if it works good for something like that, you know, that's a very high level of agitation. Then for us in our normal everyday lives, the agitation that we might have, lady slipper works quite well. So it's a harder herb to get. And back in the 80s, like I think it almost became extinct, but now it's cultivated and you know it's still pricey. You know, it's not a very common herb, but we tried to make it as potent as possible and keep the cost down as much as possible. But one of the ways that people keep the cost down is they just dilute it a whole bunch. And so lady slipper works really well, but you can try the sleep support instead, or even spikenard, like the spadric spikenard tincture. You could try using that even as something to take internal before you go to bed.
I think that's it for the
Okay.
questions for now.
So everything that we talked about this morning and yesterday is all about the state of the body. But let's drop down to page we're dropping down to page 11, 12. Hold on. We're dropping down to page 17. And here on page 17, we have just really simplified applications. So we have a whole list of different conditions and oils that are good for that, just in a very acute way. So you can see like bruises, bunions, burns, calluses, you know, and you kind of can just work your way down. So this is like kind of a quick reference guide for you to be able to problem solve different issues. And but if we go past that,
Well, can I ask you a question?
of course.
You just mentioned water retention. So for edema,
Mhm.
person has high blood pressure. So I had put him on juniper hydrosol, 3 weeks on, 3 weeks off. It reduced the edema by 75%.
Okay.
But what's a long-term? One question is, can you stop edema if the person still has the high blood pressure issues? And then long-term, you know, I just can't figure out what to do to just stop the edema, or can you not stop it if the person has
I mean, there's times where you can. There's times where you can. The thing, juniper is very good for that. Lovage and parsley can be good. Sometimes I like to use parsley, just because parsley and lovage does so as well, will kind of stimulate more appropriate like function in the kidneys.
But it makes you pee like crazy.
It does make you pee like crazy. Yeah. And the thing with juniper, it doesn't really improve kidney function a whole lot, but it does
Oh.
stimulate elimination.
Okay.
Right. So the juniper does stimulate the removal of the fluid, but
Right.
it doesn't necessarily improve it.
Right.
And so you know, it is a good way to get the fluid out, but do things to support the kidneys. You know, using those oils can be good, but also using things like rosemary and black spruce and things like that will help the adrenals and the kidneys as well. The other one that I like to use on the kidneys sometimes is myrrh. I like to put myrrh like over the site of the kidneys. And one of the things that can be helpful is, you know, before you put on the body tonic or the neat application of an oil or like an ointment, do have the person do a little bit of dry brushing over the kidney area and then apply that, because you're stimulating a lot of blood with the dry brushing, and it will take the oil deeper into the kidney tissue. And so the dry brushing sometimes just by itself can also be a treatment. There's been a few people that I had do that, and the dry brushing was causing such a shift that we didn't even use essential oils for like a month or two. And then after a while, you know, because you're increasing a lot of blood flow into the kidney area.
So
And
what kind of response was you getting? Less edema?
The body was expelling. Like it did reduce some edema somewhat. It wasn't massive, but you're trying to rehab the kidney. And so over a period of time, the kidney function did improve so that the edema did reduce. But I kind of did like more of a longer approach rather than trying to hit it all at once.
Right.
And it depends on how vibrant the person is. Like these situations, the person was relatively frail. And so I didn't want to push the treatment level too much, because I think their body would get overwhelmed a little bit.
Well, well, it's me and I'm pretty vibrant.
Yeah, you're super vibrant. So I would say go at it pretty hard with the dry brush, and then put something like even pine. Like pine could work, terebinth could work, myrrh. And those won't really necessarily cause like an increase in urination, but the parsley, the lovage, and one that's a little bit of a sleeper there is sandalwood. Sandalwood is actually quite good for the kidneys as well. And so you could dry brush and then put it over that area, and it should help with the reduction of fluid retention.
So could you help me understand a little bit about maybe the pathology of edema? So I know it has to do with the heart not being able to pump the fluids back up or something, and
It can be the heart, or it could be kidney function. You know, sometimes kidney function, the kidneys are functioning at, you know, maybe 60% rather than 100%. And so like even with heart issues, the kidneys are still involved. So you want to, like blood pressure especially, because you're dealing with fluid volume in the blood. And so the better that the kidneys function, it usually takes stress and strain off the heart. And so, you know, you still try to treat the kidneys a bunch.
So the kidneys is the primary target.
Yeah, kidneys would be primary target.
Okay.
I mean, you can treat the heart somewhat, but I always find that targeting the kidneys gets a better result.
So what is the kidneys not doing?
They're just not functioning. Like they're, you know, they're phoning it in a little bit. You know, they're not processing things quite like they should.
So
And-
I know you said lovage was your favorite for the kidneys, but it just makes me go to the bathroom.
I would try like like rosemary, or like even sage might help, or pine, black spruce, something like that, myrrh, like that can improve kidney function without
Okay.
causing an increase in urination.
Okay,
Yeah. One of the best things to clean up the tissue of the kidney is myrrh. Like it does
Okay.
it without increasing like urination. But if you're just trying to improve that, and then like if you look at it from an herbal point of view, you're trying to strengthen the kidneys rather than trying to stimulate a process. That mushroom cordyceps. Cordyceps is really good for the kidneys and it's really good for the heart. And
Okay.
so it's very good for cardiovascular issues. It doesn't necessarily like lower blood pressure or anything like that, but
Right.
it makes everything function better.
Okay,
And so if things start functioning better, at some point the body starts to regulate itself.
okay.
Yeah.
Thank you, thank you.
I've used cordyceps even when people were getting kidney transplants. We would still give them like a decent dosage of cordyceps to help the kidneys, the new kidneys, to function better. And you
Right.
know, most times you wouldn't do anything like that. But cordyceps is, I mean, it's really an amazing mushroom.
Yeah, probably
Eh,
have some too.
Yeah, yeah.
Okay, thank you, thank
You're
you.
so welcome.
Someone's asking, what about helichrysum for burns?
Helichrysum for burns, woodwork, German chamomile. I don't know what I have listed here. Let me go back and look. Lavender is usually the thing that you do right off the bat. Lavender, chamomile, yarrow. Yeah, you could use helichrysum. Yeah. Lavender or German chamomile will probably take the sting out the best. But if you didn't have those, helichrysum would work. Yeah.
Just kind of people are looking now at the
Sure.
things.
I'm whatever questions you guys want to ask.
Someone's saying, sorry, I have to find it. It's interesting that under menstrual, there's not Vitex.
That's an oversight on my part. Menstrual. Oh, you know why? It's menstrual pain. Long-term treatment with Vitex should reduce menstrual pain, but this was actually just like treating like cramping and things like that. The Vitex will eventually regulate it, but this is more of like a spot treatment when you're going through and doing it. So still could fall under there. But most times with menstrual cramping and or menstrual pain, I like to do tarragon on like the lower abdomen, tarragon or marjoram. And a lot of times with that, I put it in a base of tamanu. You don't have to, but like if you had it handy, it's the best combination. But if not, even just putting in a base of like lotion or sesame oil, something like that, that could be very helpful. And that combination is also good for what's that condition where like yeah, endometriosis. Yeah, there you go. Thank you. Where there's pain and treatment of regular use of tarragon with tamanu, I've actually made the endometriosis go away. It took a while, it took a few months, but daily application of it, we reduced it, and then next time they went to the doctor, it was gone. So I had several cases like that.
And then someone's asking, how about clary sage for menstrual?
Yeah, again, it's menstrual pain. It could work. I usually use, like, if I'm going to use Vitex, you could use Clarisage more for regulating the cycle and everything. But I mean, it is antispasmodic, so it could work. Sure. Yeah. I think mugwort's not on there as well, and mugwort sometimes is used to treat that. Yeah.
Yeah, go ahead, Letty.
Hey, lady.
Hi, Greg. Hi, Sam.
Hey.
Sorry, so I had a rough one this weekend.
Yeah, sorry,
So
sorry for all the difficulties. Like
I just gotta plan
how's
better.
your brother, by the way? Your brother's
He's he's not doing too well. He doesn't he remembers some things, but I don't think he's doing too well. Like
yeah,
yeah, it's kind of sad.
yeah.
Um, but Greg, I just wanted to mention real quick, like there's some things I'll go back on there and look to fix. Like I think menstrual, like you said, menstrual probably pain got
Yeah.
cut off.
Yeah.
So I'll go back and check tonight. But there was just something also, I think at the very bottom of the booklet that didn't have anything. So I just wanted to let you know on that. Let me see. It was something towards the very bottom that was missing. And I just had it pulled up and I lost it. Okay.
Under conditions.
Yeah, it was like almost at the very end. Like I know it's like 50 pages long, but let me see. It was sensory overstimulation for 12 for social pain. So page 49. So
Oh,
just whatever, yeah, whatever that
yeah,
is, just if I
yeah.
can just get that and then I'll fix that.
Yeah, it's up in the techniques, the sage and the vetiver in a body tonic.
Okay.
Yeah.
Yeah, because it was blank when I saw it in your notes,
Yeah,
but I guess I
sorry.
could go back up and see like, yeah, because some of them were the same, some of them weren't. So but anyhow, so I was just gonna let you know on that, and
Thank you.
I'll let everybody else know that apologies. I'll go back and check. Like some things might have gotten cut off. Like you said, menstrual. It was actually talking about menstrual pain.
Yeah.
I'll get it fixed. Sorry, guys.
Yeah, yeah. No,
Okay.
thank you. And sorry for all the difficulties.
It was just on me.
Yeah,
Like my
perfect
flash drive,
storm.
my USB, my USB was
Right,
bad
right.
again. I was like, my luck. All right, thank you, Greg.
You're so welcome. Okay. So how about we drop down to page 26, the top of page 26. So here we're starting to talk about pain, like the explanation of pain, duration. Like any time we have pain, of course it's a red alert that there's something going on with the body, something is compromised. And bottom line is it starts to cause physiological issues and starts to cause us stress. It starts to cause us sleep issues. It can start impacting our cognitive abilities with our mental function. So anytime that pain is less than 30 days old, like you have a new injury, that's acute. Anytime it's more than 30 days old, that's considered a chronic pain issue, right? So duration is based on if it's under or over 30 days. People use some different formulas for that, but that's the thing that I've always used, and it was kind of a standard in medical community back in my early days. And so also intensity will fluctuate. Like sometimes it'll be really bad, sometimes it goes down. You know, it depends a lot of time on other things going on in the body. You know, we think of pain as just being an issue, but usually it's a reflection of multiple things going on. So to approach it, sometimes one thing will work, but a lot of times you have to have a multifaceted approach to pain management, right? And so here we're dropping down into different kinds of pain. And so right off the bat, we're talking about acute pain or injuries, right? Say you're walking down the road and you twist an ankle, or somebody bumps into you and knocks you down, or you're hiking and you step on a pine cone and and roll your ankle, or you pull a drawer out and boom, something drops on your foot or something like that. You catch your foot on the stairs, or you stand up and catch the cabinet on your head. It's things like that. Like somebody this weekend, I think, broke their finger. And so again, you kind of go into what do you do in an acute situation. So right off the bat, here we're looking at pulling together things from the auric programming. And if you haven't had that class, you can kind of still do this process, or if you don't have the oils, you can just bypass it. But I wanted to lay it out. So we have an auric programming component, we have a vibrational healing component, which is the state of the body being either in regeneration or degeneration. And then we put in a couple of factors to address the specific pain. So here we're looking at auric programming. You would go through and you would do respiratory support or pulmonary stress support. Anytime you're in pain, you are struggling, and the respiratory system is struggling a little bit. If it's sharp stabbing pain, which is nerve pain, you have bronchial spasms. If it's like a dull, achy pain, you still have respiratory issues. It's just you're not breathing as deep or as long, which is what helps move the lymph in the body, and it's what throws off the nervous system, right? So right off the bat, we do the auric programming for respiratory support. Okay? Then we drop down to the vibrational state, and we treat the spinal thalamic tract. That's the thing that we did yesterday with the spikenard or the galbanum or the lemongrass, something of that nature, to help calm down the nerves in the spine and how they communicate pain to the brain and how the brain responds, right? So this helps to slow all of that down. Just by doing these two things, it usually reduces pain. But if we go past that, the next component that we're looking at is when you have a fresh injury, you have a little bit of shock, right? Your body generates a bunch of excess homeostatic emotions, and your body goes into a little bit of a shock state, so you get a little confused, you get a little checked out, you lose some muscle coordination, and it's how the body tries to handle an injury and not magnify the pain is you check out a little bit. But it's a good short-term strategy for a moment, but after a little bit of time, it actually starts causing its own kind of problems. And so the idea of using like benzoin or tarragon or rose works really well for this. They all help to reduce the shock. They calm down the production of negative emotions, like homeostatic emotions. And usually I use tarragon for this, but if you don't have that handy, you can use one of these other oils. A lot of times, like say somebody rolls an ankle, if they just pull out tarragon and start inhaling it without getting up and moving around too much, or they get up and go to a chair and sit down and start inhaling it, for one, their body comes down and their emotion comes down, and two, it reduces the spasms that are in the body because of the injury, but it will usually reduce pain from an 8 to a 4. Like it reduces it substantially. Anytime you have a lot of excess homeostatic emotion, which is the reaction to pain, anxiety, fear, trauma, being upset, it will magnify the pain. It will amplify the pain. So the sooner you can get the person to calm down or calm yourself down, the better. So like one of my tricks when I do something where I hurt myself is, in my younger days, I'd be like, oh, I gotta get up as fast as I can and like try to shake it off. Now I just sit there for a minute. Like if I've, taken a fall or, hurt myself, I just sit there for a little bit and I just let my body calm down. And then I slowly start getting up and you know, I don't feel the greatest because I just fell and injured myself or, you know, whatever it was. But I'm not magnifying or amplifying the pain. So when you have an injury, like an acute injury, there's this thing that they call RICE, right? RICE, which is rest, ice, compress the injured site, you know, like with like a ACE bandage or something like that. And then you try to elevate it if you can, just so it doesn't um, uh, keep getting swollen and blood pooling in that area. So even if you just do the rest part, that usually is quite helpful because you're allowing the body to repair itself. When you have an injury, your body needs to be able to go into repair mode. Being active and trying to shake it off, which was what I did in my youth, doesn't allow your body to repair. But if you can let your body repair, like and reboot itself, the symptoms are somewhat reduced. So the more severe the injury, the more that it throws the body into a degenerative state. You know, I was just having this discussion with somebody about a week ago, and we were talking about, you know, symptoms versus the regeneration versus degeneration, right? And you know, in the West, we really look at things more from a symptom oriented point of view. We really don't look at, okay, where's the body? What state is the body in? Like if the body is, you know, able to rest and repair, or is it agitated? You know, we don't really think of it like that. You know, modern medicine is very symptom oriented. And so, you know, this was a good friend that had sat in on the class last weekend, and you know, I'd really talked about it quite a bit in the weekend. And she goes, now that makes whiplash makes so much sense. She said right after she got into a car accident, you know, she had gotten several healings and gotten some therapy, and the idea was, okay, the symptom, you know, you got healing right off the bat, just, you know, don't bring it in, don't bring it back. Or, and she was like, the symptoms would quiet down for a little bit. And then she goes, in a little bit, I'd feel like crap again. And, you know, I was thinking, is it me? Is it my emotions? Is it what am I doing that's doing it? And the issue is that the body goes into a degenerative state, and it produces symptoms, it magnifies symptoms, and you become less responsive to treatment. And so the idea is to shift the state of the body so that your body can respond to the symptom-oriented treatments, right? So just treating a symptom is can be good, but shifting the state of the body is better, and then the symptom-oriented approach becomes much more effective. And so in this acute injury kind of situation, the thing that you really want to do is you want to calm down the generation of homeostatic emotion, right? Because you've been displaced. You're basically having a very strong stress response, and your body wants to protect itself. It wants to motivate you to protect yourself. So it starts generating emotion for you to take action to fortify the situation, your environment, whatever that might be, so that the body stabilizes. Well, most times it's an overreaction in the body, right? It's just what happens. Like nobody's immune from it. Like it is not something like, did I do it? Did I not do it? It's, you did it. It was, how bad was it? Like, that's really what you got to look at. And so, this component of treating the homeostatic emotions right off the bat when your body gets injured can be a game changer, because it will dictate really how long and how intense the condition's going to be after the fact. And so a lot of times, like, we'll go to a rolled ankle. Like somebody's twisted their ankle. Like if I can get to them right off the bat, like right when it happened, and either do healing or have them do like one of these oils, it will dictate if that's going to take a few weeks or a couple of months to get better. Like it literally is like that much. If you can calm it down, the quicker you can calm it down, the quicker your body's going to start regenerating. And if you let it go for a little while, your body just goes into a deeper state of degeneration, and it takes more to pull the body out. You still will pull it out. It's just, it takes longer. And so when I was explaining all this in last weekend's class, she goes, now I completely understand my whiplash. And this is why whiplash is so difficult. Is like, at first you have the injury and you have a little bit of pain, and then a week or two goes by and your body just keeps feeling crappier. Then over a period of time, you start having sleep issues. Then eventually digestive issues start to happen. And a lot of times there starts to be blood pressure issues. And it's just because the body goes into such a degenerative state that the symptoms keep spreading out into other symptoms, into other areas of their body. So a good example of this is people will injure their neck in a whiplash, and then within a couple of months, their low back hurts as well. Like their neck hurts and then their low back hurts. It's because that issue is still continuing to happen, even though it happened months earlier, but it's still manifesting in the body through this degenerative state. So now it starts to go into the low back. Now it starts to go into the jaws. Now it starts to go into these other areas. It starts to throw off digestion. It starts to throw off your blood pressure. It starts to throw off your sleep and how you sleep. And it just kind of continues. And you can treat it from a symptom-oriented point of view, but a more effective way is to isolate what's degenerating and then treat it. And if you're not sure, then you would do like all the things that would pull your body out of the degenerative state, which last weekend it was all of Sunday, the physical component of vibrational healing, right? So here I put in the shock and homeostatic emotional response, because that is the specific thing for that condition. Like that is the part that, if not handled well, will cause the body to continue to degenerate. So right when you get an acute injury, even if it's like, okay, I injured myself 4 hours ago, I got home, I'm going to rest, I'm going to inhale some tarragon or rose or benzoin. Could use that blend Alay that was from the last weekend, which has a bunch of melissa and chamomile and frankincense in it. You inhale that and you let the body keep relaxing, and that combined with some good sleep, a lot of times the body will repair itself very quickly, right? And so from there, then you go to what can I use for the pain? And anything that's like a new pain, helichrysum really is kind of your best friend. Like if you had just a couple oils that you traveled with and you go, in case something happens, what can I use? Helichrysum and marjoram both work well. Helichrysum's a better pain reliever, and helichrysum can handle the open wounds much better than anything else. So like it will cut down the bruising, it will stop the bruising. If bruising's already there, it will break up the bruise. Like within 24 hours, it starts to break up the bruise, and that old blood gets absorbed by the body, if there's swelling, it cuts that down and reduces the pain. And if there is an open wound in that area, say you open up a drawer and it falls on your foot, and yes, it's swollen and yes, it hurts, but it's also broken the skin. Helichrysum has a cleansing effect on any sort of bacterial kind of issue that might be there, but helichrysum also helps the wound to bind. Like a lot of times if you put helichrysum on, you can almost see the wound starting to move together, right? So it will bind the wound much quicker than normal. Helichrysum is also what you would use for scar tissue after the fact. So that combination of having tarragon in your pocket and helichrysum, very good combo for any sort of acute injury. Looks like you had a question.
Yeah, so we're on D, right?
Yes.
So what it says, strain, sprain, or spa?
Strain.
I think something just maybe got cut.
Yeah,
off.
I got cut off. Strain, sprain.
I could look it up on.
No, I'll look it up on it.
I-
It's a spa day. If you want a spa day, let's look.
And then also a second question was, what's the application?
Topical. You just put it directly on the area.
Someone's thinking it's probably spasm.
Probably. Yep, it's spasm. Haha.
So. Okay, so neat is the application and it is
Yeah.
spasm.
Yeah. Birch complex. I find birch complex very interesting. It's, you know, I do not put that on an open wound. Like most times you're not dealing with an open wound here. But if you are, helichrysum is the trick. But birch complex, it's both regular birch and birch tar, wintergreen, and then it's other things that are helpful for different pain syndromes. But like when pain is intense or when it spikes, I find that it helps to release pain, like not just like soothe the pain, but you know, when there's like emotional pain, I use birch complex. This is going to sound really weird, but when I do like purifications and meditation and things are coming out, like, you know, some from my psyche or some from my past or something, and it comes out and makes the body not feel good and not be like, yeah, I don't feel good. Like this thing when I was, you know, 8 or 10 or, you know, whatever. Sometimes I don't even know what it's about. But it will start to make the body feel uncomfortable. And I'll, you know, do my little tricks and I feel a little bit better, but it still doesn't feel amazing. And then I break out the birch complex and all of a sudden the body just goes, oh. And so, you know, most of the pain blends are relaxing to the body in the kind of way, in the type of pain that it is, because each one has its own kind of tension that it generates in the body. Birch complex, I would say, relaxes tensions in the body due to pain across the board. Like doesn't matter what it is. And so I'll put it on the body. I'll take a salt bath with it, but sometimes even just inhaling it and putting a few drops on the wrist, and I feel so much better. You know, you'll kind of notice that, like sometimes with pain, it'll feel like your body feels like it's like you feel like the Michelin Man. You know how like everything feels big and your solar plexus is congested, and as much as you try to make it go away, it's just like just won't stop. And you know, I'll put galbanum on, you know, I'll do all my tricks. And it's like, I'm feeling better, but I'm still not feeling great. I'll put birch complex on and it's just done. It just feels super done. And so that combination of the birch and the birch tar and the wintergreen, and it's got other things, like if I remember right, it's got like ginger and, you know, all kinds of things. It smells very medicinal, but as far as like a general pain reliever, there's two that really shine. One is nerve help and the other one is birch complex. Those two are across the board for any kind of pain. Those two are go-to pain relievers. So
The spagyric wintergreen, would that also fall into that?
yeah, you could put the spagyric wintergreen on an area. You know, it's not something that you take internal, but it's something that you could make a you know, use as a body tonic. And the thing with wintergreen like going back to what like Zakia was saying about like fluid retention, birch and birch tar are really good for reducing fluid in the body. You know, especially if there's like arthritis or something like that, where there's puffiness, it's one of the things that helps to move the fluid in those particular areas. Wintergreen, on the other hand, not so good for fluid retention, but wintergreen is really good for spasms, especially really chronic spasms. So like when somebody's saying, what would you do about chronic things in the calf? My first go-to would be larch, like we were talking about, but wintergreen would probably be in the mix if the larch wasn't really cutting it. You know, the larch is treating the overall body condition. Wintergreen isn't treating the overall body condition, but it's treating something very specific. So anytime you have not just spasms and tension in the body, like contracted muscles, but like when they've been there in a chronic way, like your back is tightened up to try to prevent you from hurting it further. Like, you know, you have spasms in your low back, and as much as you try to get them to relax, it's like, you know. So the Pain Soothe blend has some wintergreen in it. Birch Complex has some wintergreen in it. There's other blends that have some wintergreen in it. And part of the reason why it's in there is it's a good pain reliever, and it's very good for really stubborn spasms that have a hard time relaxing. Stubborn and chronic. And so you can use the wintergreen by itself, but I tend to use the Birch Complex for stuff like that. Yeah. And then, like, if you were to get a body tonic, for example, of Birch Complex, I actually put the tincture of wintergreen and the tincture of birch in the Birch Complex body tonic. So you kind of get the essential oil, but then you also get the herbal components of that as well. So
I can see my new favorite product.
yeah, it's very nice. Yeah. I like that on my hamstrings and my back. But you know, I go back to like I use that and I think it's amazing, and then my back feels better. And even though I think it's amazing, I stop using it because I forget about it because I don't need it anymore. Prevention's always the best place to treat these things, but you know, usually we end up doing something because the body is screaming at us rather than, you know, us taking care of things before the fact.
Yeah.
Yeah. Any questions or anything about any of that? I think it's relatively straightforward, but sometimes personal applications might be a little bit need some further explanation, or you want to apply it specifically to something going on for you, or
So the spagyric wintergreen in the kit, what is its best application then? Because you were saying the birch,
apply it to an area topically.
just any pain.
Yeah. Let me see here. Like for those of you, let me see what we got going on. Yeah, for those of you who got the pay kit and you have the spagyric wintergreen body tonic, shake it up and put it on one of your shoulders, like or one of your hips, and then compare the two. I mean, it's very nice. Very, very nice. Yeah.
I just rolled the birch complex all over both of my shoulders, so I'm gonna have to wait.
Like as a roller ball or
Yeah, I keep.
oh,
my-
I'd go ahead and tear into it still.
Oh, I did. No, when you were talking, but I put it on both.
Did you do the wintergreen as well?
No, I haven't done, do the wintergreen.
Yeah,
still
go ahead
anyway.
and do the wintergreen over the top.
So the wintergreen spagyric, someone's asking, this was the first time we put it out
Yeah.
in the spagyric, so
Yeah.
we'll get it up on the site.
Yeah, we'll get it up on the site, and I've had it for a while, but I usually just add it to things. But part of it with the kit, I thought I'd give you guys things to play with and experiment so that you knew what worked for you and what didn't. And so I would say experiment with the wintergreen body tonic and just slap it on an area and see how it feels. My personal favorite is the tops of the shoulders and then the low back. But if you have like a bad knee or tight hamstrings, shake it up and put it on the knee or the back of the hamstrings. See how that treats you.
Will a birch tar body scrub help with water retention?
Probably not strong enough. Like it will move some things, but it probably won't reduce fluid a lot. You know, a lot of times you have to put the birch on the body either in a knead application or like in a body tonic for it to be effective.
Is birch complex body tonic good for tight calf muscles?
Yes. Yeah. But if you got the wintergreen, like throw the wintergreen on there. Yeah, tight calf muscles. I mean, a lot of times I would suggest with like pain and body tension and things, like try rotating things because you know the body the body will shift, but sometimes it still needs things from other plants to help like a deeper shift. And then when you come back around to the wintergreen or the birch complex, it will work better, it will work deeper. And so I always find like the rotational approach where you have a couple different things that you use and you're not using them in the same day, but you use one day you use this, the next day you use that. Um, I find it helpful. Like I rotate a lot between larch and then marjoram, like as a body tonic. And every once in a while, I'll throw in like blue healer or something in the evening. And, you know, it all just keeps me sleeping good and feeling good and reducing inflammation in the body. And like, I don't necessarily have like, this is what I do every day. I have like a little stack of things and I'm like, feeling like a marjoram night. Like, you know, because the more that you do it, you'll kind of know like my body needs marjoram right now, or my body needs the wintergreen. My body needs blue healer. Like, you know, blue healer, I find, or any of the blue oils like yarrow, blue healer, German chamomile is good for reducing inflammation, but also when you know how like when you're not feeling good, your body just starts to feel a little agitated. Like you feel like a little like one more little thing and like I'm just I'm at my threshold of what my body can handle. That's when blue healer or something like that is very calming and soothing. It just calms everything down. So a lot of times when I use blue healer topically, I use yarrow internally.
So what is the birch tar body scrub good for then?
It's still good for moving lymph and like pain related issues, but it's mostly for like moving lymph. Yeah.
That's what I do. I have the body tonics in my bathroom counter.
Yeah.
I
Yeah. Yeah, my whole little nightstand is like shelves of just different body tonics that I'm like, tonight I'm gonna do this one. And you know, I'd love to say like, oh, I use this one and that one's amazing, but like it usually is depending on how I feel, what I've done that day, you know, how my back's doing, how I've been sleeping, and you know, certain things will make some of the sleep better, or you know, but the more that you kind of play with them, the more you go, this is the one I need tonight. Yeah.
So I had a question,
Mhm.
just because I thought it was so interesting, the pain class, and then as far as the ARIC programming ones, the ones you chose were respiratory.
Yeah. So the idea of with the org programming for the acute pain, not all the pain classes or all the pain conditions have respiratory system as the ORIC programming, but a lot of them do. is when you're in pain, one of the first thing that goes and starts to fluctuate in its function is your respiratory system. Like your lungs, your bronchioles, even the sinuses, all these things begin to fluctuate and not function as well. And that also is what magnifies the pain. If it's sharp stabbing pain, it increases the intensity. If it's dull, achy pain, part of that is lymphatic stagnation. And part of how the lymph moves through your body is through respiratory function. And so if you're not breathing properly, then the lymph isn't moving properly in your body. So one of the things to stabilize pain syndromes is to treat the breath. You know, when you treat the breath, then treating pain becomes much easier. If the breath is erratic, it becomes very harder to control and manage pain. Yeah. So,
Yeah, go ahead, Zakia.
hey, Zakia.
I think you can unmute. Maybe you can't. I thought I made it so you could. Yeah, you should be able to. Let's get you unmuted.
What I meant, can you hear me now?
Yes.
What I meant to ask you, you had mentioned earlier about where a pain is might not be the source.
Most times that's not.
So my friend with the spine, he said he's been to doctors, they can't find it. So what else might I look like? I mean, what else might I
with
look
that,
at?
like that is most likely, again, the breath. Like you want to deepen the breath and relax the diaphragm, because like if he's having pain up and down the spine, the multifidi, the little muscles in between the spine, they kind of crisscross and go up. They're
Right.
tight and they're compressing the nerves, right? They're compressing the spinal nerves. And so going through and unwinding the breath a lot of times will make the back and the spine, it will ease the tension and ease the pain and start to increase mobility and flexibility. So that's where I would start with that.
Where my mind went, because we're doing this chronic healing certification, and they've got this correlation between the chakras and the body parts. So I was thinking the spine and the root or basic chakra and what other organs might be affected. That's where my mind was going.
Yeah, I mean, treating the basic chakra, it would be okay, but like if you look in the booklet for like herniated discs or things like that, one of the big factors that will impact the compression or the tension in the vertebrae and on the cartilage, you know, the discs and the spinal nerves, is the back solar plexus, because the back solar plexus directly corresponds to body tension. You know,
Okay.
like the more that the solar plexus is congested, the more body tension you're going to have. And
Okay.
so the back solar plexus is also the diaphragm. Like
Okay.
it's so you're looking at it from a physical point of view, you would hit the diaphragm. If from an energetic point of view, you would hit the back solar plexus.
Okay.
Yeah.
And
Same idea though. You're on the right track. It's the same idea. It's just
okay.
energetically, the solar plexus is going to affect the diaphragm. We're just going right to the diaphragm.
Okay. And then would there be a specific essential oil for that, the hyssop decumbens, or just go with everything we've already said?
Yeah, the things that we said, you could even use that on the back solar plexus.
What on the back solar plexus?
Sure.
What?
Which one she's asking?
Oh, I would use larch or hyssop, you know, something like
Oh,
that.
okay.
In years past, like if I really wanted to go deep on the solar plexus, I would use chakra root cleanser.
Oh, okay.
It goes pretty deep. You know, you'd have them inhale on that, but I would still go in, and just because you clear out the chakra doesn't mean that the diaphragm relaxes immediately. So you could do a combination of the two.
You know, mentioning chakra root cleanser, yesterday's class, you had us work with mugwort.
Uh-huh.
And I know mugwort opens all the channels, right? So you was
Right.
having us applied all over the place. I started crying like all day. I mean,
Oh, did you really?
and that's why I just stopped the class. I just left the class because I would be look at lunch, right? I would look at something on TV or Netflix, and I would just cry at every little thing.
Oh,
And
wow. Yeah,
and
you're
I would,
releasing some.
yeah, I know. And I got so, I didn't get mad at myself, but I was just so discombobulated. I,
Yeah,
I was like, why are you crying? I watched
right.
something on TV. It's like, I would just start boo-hooing. It's like, give me a
Right,
break.
I know, huh?
It was like,
Right.
that's why I left the class yesterday. I
Yeah.
said, okay, just sit down and be still.
I mean, that's the thing. Like you said, the mugwort and chocolate cleanser really gets things moving.
I
You know?
know.
And so if there's something stuck in there somewhere, boy, mugwort will get to the root of it.
Boy, I must have
Yeah.
let go some stuff. I was just I was beside
Yeah.
myself. Anyway,
You know, another one that does that I don't talk about very much is Anua. Anua, or like, you know, I have two types of Anua. So one I call Anua, and then the other one is the same plant from a different region, but it's Sweet Anne. Sweet Anne or Sweet Annie?
Sweet Annie.
Sweet
is what we
Annie.
call it on the site.
Yeah.
I keep Anula under my bed because not under my bed.
So
under
it's
my
not
pillow.
Anula, it's Anua. Like it's
Oh.
it's a
Yeah.
different, it's in the mugwort family. It's in the Artemisia
Oh, I
family.
thought you were saying Anula.
Yeah.
Okay.
So it's a very interesting plant.
Okay.
You know, in the old days we used it to treat to reduce viral activity. Like when you wanted to calm down a virus, Sweet Annie or Anua would be what you would use. I think I just said Sweet Annie though. Back then I don't think I had the other source. So but you know, it cleans up the aura, it straightens out the health rays, it cuts cords. You know, it's very multifunctional, but it's a good cleanser as well.
Maybe in that body tonic with marjoram, I can put some chakra root cleanser
Oh yeah, yeah.
for the spine.
In fact, marjoram. Let me look what I do with chocolate root cleanser. I can tell you.
And our Anua on the site is 2 ends. Is that accurate?
Yeah.
Oh,
Yeah.
that's my bad.
Yeah. So when I make chocolate root cleanser into a body tonic, I add the tincture of mugwort. You could do it with marjoram, but you know, chocolate root cleanser has a bunch of mugwort and artemisia in it. And so the tincture just augments what it does, but
Right,
you could still do it with marjoram. Yeah.
right. Thanks.
Yeah.
Can you take Sweet Annie internally for viruses?
I would say probably not. Like you can take the herb Sweet Annie internally, but the essential oil is a little too potent. You know, the chemical or the chemistry that's involved, like it's a little too strong. It actually works better with the essential oil to apply it topically or inhale. Yeah. Yeah. Very good though. Very good for calming down viruses and yeah. It doesn't work on viruses the way like Melissa or Monarda does, or bay laurel or Eucalyptus radiata. It calms the virus. So the idea is that in really chronic viral conditions, sometimes when you're taking a substance going out trying to neutralize the virus, sometimes it does a thing where because the body is starting to go after the virus will step up what it's doing before it dies away. And so the idea was to calm the virus down. So basically you take down its ability to fight and thrive while you bombard it with things that are antiviral. And so it does have antiviral properties to it, but more than anything, it makes the virus feel like it's Sunday. That's the way I used to describe it. It just calms the virus down so that your other treatments can be more effective. But
So in that case, this isn't quite a pain question, but yesterday what we
Sure.
did with the mugwort, with the whole process, if somebody's getting sick, would it be even a thing to do before? So like that would maybe calm the system
It
and then
could.
you could do the
Yeah.
antivirals?
Yeah, you could, like with Sweet Annie or with mugwort.
Oh, well, I was thinking yesterday's process with
Yeah,
mugwort.
you could do that. Like if you're starting to get sick, you might want to do it like in the respiratory tract and the throat. Yeah, you could do that, but it wouldn't be a replacement for, the Menarda or the Melissa. You still would want to do that, but you're just opening up the channels so that your body responds to treatment a little bit better. But usually when you're starting to feel crappy like that, doing a bunch of long processes becomes harder. So if you had to pick or choose, I would go to the things that we've always talked about.
Mhm.
But if you're feeling up to it and you're just laying there and you feel like you could step it up a notch, you could add mugwort to it. Mugwort or the Sweet Annie. The thing that I would say about Sweet Annie, this is why I don't talk about it a whole lot, is it does make the body expel. Like it really makes the body expel. And so I have a healthy respect for Sweet Annie. Like to a new person, I would say like that's for the veterans. You know what I mean? Like that's not for somebody who's gonna just want to treat something in a symptom oriented way. I mean, it has a very good effect on the state of the body, but it will make you expel. It will throw off the lower vibrational energy pretty intensely. And
So someone's asking what's expelling, and it's
lower vibrational energy, like wherever you direct it, it's kicking off, the elementals and the blockages and everything. And so, it straightens the health rays. It helps with cords. It cleans up the spine. It's considered a restorative to the homeostatic mechanisms, but it's not screwing around. Like, where other things they're calming and soothing. Like Sweet Annie is like, you will get better, like, whether you like it or not. And there's been times where I've used it, and I was like, whoa, so this is a little spicy, so I kind of refrain from always talking about it a lot. But
just inhaling it or a pack?
inhaling it, and I put it on the skin. Like if if I have an area, because it's antispasmodic, it's anti-inflammatory, and I'll put it neat on a particular area, but even that area, I can feel the energy coming off quite substantially. And so, I'll do it, but your body gets congested for a little bit as it's kicking off that energy. So,
Is
lot
it
of
in
times,
the spagyric or just straight to the leaf?
I'm in the process of making a spagyric version.
So
yeah.
currently we can just order the Sweet Annie off the site.
Yeah.
It's a
So
tincture?
no, it's essential oil. You could
Okay,
do either Sweet Annie or Anua, which is ANNUA.
right.
And they're the same, they're just from different regions. So whichever one you want to get, they're both
So here's another
like
question. You
it's like
know,
mugwort and artemisia. Like, they're both
right,
mugworts, but they smell different and they're from different regions.
right,
Anua and Sweet Annie are kind of like that.
right. So here's another question for its use. So
Mhm.
when we do pranic healing and we have our cleansing spray,
Yeah.
would that be a good application for the Ania? I mean, the Annie,
Yeah.
Sweet
Yeah,
Annie, to
you could
put
do
that
that.
in there?
Sure. Yeah.
Thanks. Thank
Yeah.
you.
Yeah. That's when you're doing those healings, when you say to the person, I mean business. You will get better.
Whether you're receptive or not.
Thanks.
You're so welcome.
Just inhale a pattern?
The pattern would depend on what you're using it for, but inhale or put it on the body topically. Yeah.
What would you do to clean up the expelling?
A salt bath, like, salt bath like chocolate root cleanser or Palo Santo or hyssop, something like that. Even like spikenard, you can get and take a spikenard bath or marjoram bath. The salt will clean things up, and so
And would you make it into a body tonic?
yeah, sure. I'm in the process of making the tincture, so where we can make the body tonic right now, and I would probably add mugwort as the tincture, but in about 4 weeks, maybe 3 weeks, I'd have to look at the date of when I put the tincture in. I'll be able to make the tincture and Anua at the same time. Like, it would be both the same. Yeah. So.
And go ahead, Zakia, then Laura.
Hey.
I'm on the roll here.
Yeah, go for it.
We don't get a chance to ask random
Yeah,
questions.
yeah. That's what the whole day's about. Just let's chat it up.
So would it be good to use your body tonic as a base for that cleansing spray for healing sessions?
I honestly, I would probably just put the essential oil in a spray, and the tincture would make it stronger, but the problem is that the spray bottles get clogged really easy.
Right,
And
right,
as much as we try to get all the plant material out, there's
right,
always a little bit in there. You know what I
right,
mean? And so, I mean, you could try. I've done it, and the spray works for a little while, and then the sprayer gets clogged, and I have to
right,
rotate it out, and so. There are some sprays that have, like, the ones that are more like a pump like this, and they'll have like a little screen at the bottom of the tube
right,
that comes down in. I tried that and it lasted longer, but it still got clogged.
right,
And so it's like if you put a little pinch of salt in there to like try to increase the cleansing, it works for maybe a third of the bottle, and then the sprayer gets clogged.
right.
And so I would just use the essential oil and alcohol.
Thank you.
Yeah. If you wanted to amplify it, put a little holy water in there.
Well, yeah, that's right. I normally use that and
Yeah.
right, right, yeah. Thanks.
Yeah.
And go ahead, Laura.
Hey, Laura.
Hey, so continuing the Sweet Annie Anua, would putting it on your arms and legs for like getting rid of lower energies?
Oh my God, yeah, it would clear things out. Yeah, it would definitely clear things out. Like, I put it on my back, I don't know, about like a week or two ago. And I was like, "Whoa, my solar plexus is getting a little congested." And then I started looking at my energy body. I was like, "I'm congested in a bunch of places." I had to take a salt bath. And so wherever you put it, it will clean. Like the thing with like Orange Healer and Opa Doc, they're good cleansers and they're like stable. You know what I mean? Sweet Annie, it's a good cleanser, but it is gonna, it's not that it's unstable, but it's gonna make your body release whether you like it or not. And a lot of times you either gotta sleep it off or take a salt bath or spray down with something. Like, you usually need to augment it with something to keep it moving. Like Zakia is talking about doing healing and spraying. That would be another way. But most times for me, I put it on, I let it cook for maybe about an hour, and then I go jump in a salt bath.
So I've been cleaning out a house that has a lot of stuff with energy. Is Sweet Annie as good as anything to just kind of clean myself up?
Oh yeah, it would clean things up substantially. And it would also, like, if you burned it as an incense, it would clean the environment probably better than anything else. But
Okay.
again, if you're in the room, it's going to make you expel. So that's why even there, I haven't talked about it a whole lot. Like, other things will make you expel, but like, oh, it expels and then your body kind of regulates. Even that frequency incense that we had like a little while ago, it makes you expel a little bit harder, right? the sweet Annie makes you expel, and like, you know, if you're doing something, it's like, I think I need to clean up a little bit. So that's why I haven't even put out the incense. I mean, I have a big batch of the incense, but we just burn it around here, like, you know, in the shrine room, or um, just areas where maybe I've been doing healing, or you know, just to clean up the area. But I usually burn it and then sit there for a couple of minutes, and then I get up and walk out, and then come back in later. You know.
So can Sweet Annie go into a salt bath?
Oh yeah, yeah.
And would that accomplish both things, like
It
the
would
expelling and the
it would
cleanup in
clean you
one?
up a little bit, but I find that the sweet Annie, like, I would do it, and then within maybe an hour or two go to bed, and then maybe when you get up, just like spray down a little bit with something like, you know, poplar, or just, you know, any spray, hyssop, just to kind of clean whatever comes off. But for me, what I notice is that I have like kind of intense dreams, and I'm releasing things even from the psyche. Like, it's like I am releasing. Like, it's just, you know, I was talking about um I personally love artemisias, like, you know, the whole family, and the whole family of artemisia. You know, it probably, in the botanical family, there's probably 250 plants in the artemisia family. There's probably only about 12 to 15 that are in an essential oil form. But my friend, he always laughs at me. Because, like, you know, he's an old school medical aromatherapist, like back from the day. And we'll start talking about oils, and I usually mention like mugwort or something, and he'll always start laughing, and he goes, you realize artemisias are kind of crazy. And I was like, yeah, it kind of fits. But like, the way the plants grow, they they're very like adaptive to the environment. And like, when he says they're crazy, like, it's they're very good for handling and managing like chaos in the body. But for me, it's like there might be chaos in the body or in the emotion or mind, but also there's chaos all the time in the environment. And a translation of chaos is lower vibrational energy, you know, people being weird around you, you know, people being unstable, you know, whatever it might be. And so the Artemisia family, like tarragon's in the Artemisia family. Think about how soothing it is when things are crazy and chaotic, when you have shock. It brings order to the chaos. And that's what I tell him. I was like, I love Artemisias because, you know, the world is a chaotic place. Like, it's not a super stable place like it was many years ago. And Artemisia is like kind of one of those things that I use for any of those things. So if you look at a lot of the blends have Artemisia, some form of it in there. And it's because of like how much it kind of purifies, cleans up, gets things moving, gets things flowing. Like, the chaos is resolved with Artemisias through movement. Like, it establishes like a healthy movement. And so you could use any form of Artemisia in those kinds of situations. I mean, if I come across a mugwort from a different vendor that I have never gotten before, I get it, because I have this like little collection of different mugworts, and I'm like, gotta have the mugworts from all the different areas. And you know, a lot of them are very similar, but still, that's how much I love Artemisias. Like, I have my little personal collection of several different kinds of mugworts, and I just found another one that so, you know,
Thank you.
yeah.
I think that's one of those geek out moments. That
Yeah,
you
it's a
just
super geek out
confessed.
moment. Like, I'm very geeky about Artemisias. Sweet Annie is I used to talk about it, like, I think it was before we were doing patterns. We would just do sequences of oils.
Mhm, yes.
And I stopped talking about it when we started doing the sequence of the oils, because I remember we were talking about it, and I was like, might be a little too strong, not for all of the students, but for some of the students. Like I feel that that's like somebody who's been in the classes for a while or something that we break out. And so, you know, like if I gave it like a family member and in my family, you know, none of them do any of this stuff, it would flip them out. Like it would make them feel uncomfortable and stuff would be coming up and out, and you know, they'd be thinking differently than the way they do, and which I think is a good thing, but I don't think they would think it's a good thing. So I refrain from throwing it out there a lot.
Thank you.
Yeah. Makes me want to go burn some incense right now.
Oh, well, we have.
I want some of your
do that
sweet
here.
Annie.
Yeah, well, we can add it, like we'll add it, and if you want it, we'll have to give some sort of explanation of, yeah.
Oh,
But
yeah.
Yeah, we could totally add it. Yeah. And the thing that's also nice, it's not a super expensive oil. I mean, it's you know, there was a person, you know, I was just talking to my buddy yesterday right before a class. He's over in Europe right now. He's from the US, but he's over there researching a project for like he's doing a book on like perfumes and things and using essential oils to make perfumes. And so he went over to Italy to go to like the museums and things for fragrance, and you know, they have a rich history of information over there with these things. And he said over there, it's not in publication, but there's a lady who wrote a whole book. Like he said, it's a big book too, and it's just on Sweet Annie. Like it's nothing else but just Sweet Annie and all the therapeutic applications. And the book, I think, got banned in Europe. Somehow the European government shut it down. And so, you know, there's like a few bootleg copies, but you know, we were talking about Artemisias, and he's like, you know, here's another one of your Artemisias that you love so much that people are talking about. And it's kind of like, you know, how like sage is a cure-all and lemon is a cure-all and lemongrass is a cure-all. I would put Sweet Annie as a cure-all. Like that's the way that I would put it. And he was saying that the woman in the book didn't necessarily say cure-all, but he said so many different conditions that it could be something that you would use it for, that it's starting to fall into the realm of, you know, being a restorative or a cure-all. And so cure-all just means it just keeps easing the body. I mean, how we're talking about the degenerative state versus the regenerative state, it keeps nudging the body into restoring itself in a regenerative state. And so yeah, it's one of those ones that does it.
And then go ahead, Susan.
Hey, Susan.
Hi, I just
Hey.
love that frequency incense. I love it
Yeah,
so
isn't
much.
it
I
nice?
I haven't been burning it, but I put it in my kitchen right where I walk by all the time. So every
Uh-huh.
time I go by it, I sniff it a little bit.
Oh, nice.
Yeah. So one thing that happened to me, I wasn't even gonna participate in this workshop because pain's really not an issue for me.
Mhm.
But I started having this uncomfortable feeling under my diaphragm on the left side.
Okay.
And that started all this week. And then yesterday I broke out in a rash in the same spot on the back side. And now it's starting to spread to the front side. And
Ooh,
it's
that
not,
sounds like shingles, maybe.
yeah, it
Is
does sound like
shingle?
that.
Yeah. So Ravensara is very good for reducing shingles. But the other thing is take from the health food store, go
Uh-huh.
to the health food store and get L-lysine
Okay.
and take some big dosages of it. Like a
Okay.
lot of times, if I think I'm starting to break out in shingles, I'll take 3 or 4 tablets a couple of times a day, and within a couple of days, it stops and reverses. And then if it's really broken out in that area, it's a really stinky solution. But at the health food store, I mean, we have it here, but you can just run to the health food store and get it.
Mhm.
Is neem. Get some neem
Oh, yeah.
and rub some neem on it, and don't wear any clothes that you want to keep because, like, I don't know, for me, I'm not a big fan of the smell of neem. So I put on an old t-shirt or something, I rub it on, and between the L-lysine and the neem, within like 48 hours, it's usually resolved.
I take the neem internally. I just do that
Yeah.
anyway.
Yeah.
It's
I-
not
I
bothering
don't-
me. I've been taking the yarrow just because I had it and I feel really
Oh,
chill.
yeah, good. Yeah. Yeah. But try the L-lysine.
Okay,
I would still put neem on it topically. Like the neem internally is helpful, but topically it's even better.
okay.
Yeah.
Thank you.
Yeah, you're so welcome. Keep us posted though. If you need more support or something, let us know.
Okay, thanks.
And then the Ravensara is also topical.
Ravensara could be topical and or internal. Yeah. Ravensara also very good antiviral.
And go ahead, Sonia.
Hey, Sonia.
My mom had shingles and I just put her in a salt bath and it cleared it all up. It
Oh,
also
nice.
will clear up impetigo and fever blisters and all that stuff.
Just the salt bath did it?
Yeah, I like to put other stuff in mine, but I've used it plain salt, salt in a drop of water just for like fever blisters, and a lot of times then it won't break the surface or it clears that up really quick. But
Okay.
my uh, uh, granddaughter was like 3 and she got impetigo, and I told my daughter to put her in a salt bath, and she did, and it cleared it right up
Oh,
immediately.
wow. Very good.
But for my mom, the shingles, and it was just a salt bath.
Nice. Okay. That's good to know.
And then someone's also asking, would Birch Complex release a tight piriformis? Also, would Balance ointment that Greg talked about yesterday help release a tight piriformis muscle?
I would probably use the Birch Complex. Yeah, the piriformis when it gets irritated because it's tied with sciatica and things like that. It usually needs a little bit stronger, like the Balance might be helpful, but it probably needs something a little stronger, like the Birch Complex. I mean, you could probably get away with marjoram, but a lot of times I even use like the pain relief neuropathic, which has a lot of mint and corn mint in it. So the mint will decrease the pain in the area if it's present, but it will also be anti-inflammatory and antispasmodic. And so that can be helpful. The thing too is like try not to like sometimes people will say, oh, you have a tight hip, like sit on a tennis ball or push on it real hard. With the piriformis, when it's aggravated, don't push on it at all. Just lightly put the oil on and then let that be, because it when it gets aggravated, it gets irritated really easy. So I would just let that be and just try to relax it through topical application. Yeah.
And then go ahead, Lolly.
Hey, Lily.
Hey,
Hey.
so okay, well, a few things. Let's go to a really simple one. So Ralph asked yesterday actually about something related to the face and like generating like lymphatic movement with something that's been there for a while. What I'm wondering about, I mean, realistically, if we're talking about like marjoram and then using like, cypress or cedar on the face, I don't know if it's always like if the skin is really sensitive. I'm not sure if that's like ideal.
Yeah, on the face, I would mix it with probably like some witch hazel or something.
Right.
Witch hazel, or I mean, worst case scenario, like I mean, water is not going to allow it to penetrate quite as much. So, but you could add like water with a little bit of alcohol in it so that you can rub it on. And I mean, it's still going to be a little bit drying, but it will still penetrate into that area. And so marjoram and cypress or cedar are relatively gentle on the area, but it's still, the face can be extra sensitive. So I would,
Yeah.
let's say it would depend person to person. And
Yeah. And so
Um,
what I'm wondering about is if you're working on the lymph nodes on the neck,
yeah.
would that stimulate basically the movement on the face?
Yeah. So, you know, because I was thinking this out too. Like after class, I was like, boy, how could you go at the face a little bit harder? And so I like the idea of especially like under here,
Yeah.
you know, because even there's times where treating this area under here, I've actually even been able to reduce like blood pressure in people, you know, because of like the nerves and everything that are in this area. And so, you know, you could treat the whole throat and underneath the chin with the marjoram and the cypress. And then I was thinking like taking something like helichrysum might be my tied for first choice. My other second tied for first choice would be coffee, and put like a drop or two of the coffee essential oil in and like a soap or something, and then, you know, lather and clean the face that way, because the coffee like really substantially jumpstarts lymphatic function, especially in the skin. And so, you know, you're opening up the nodes here. I take a little bay laurel internal to also
Yeah.
open up the nodes, and then do the coffee or helichrysum on the face. And I think that could be a way to open up the lymph in the face. You know,
Okay.
because a lot of times it's going to be like in and close to the nose
Yes.
and like in here, and then over
Exactly.
here, and then up into the temple area.
Mm-hmm.
Yeah.
Yeah. Okay. Thank you. I can try experimenting with the coffee and see how I can make it into like a, yeah.
I would say, you know, like sometimes when people do like facials, like
Mm-hmm.
sometimes they'll use like a little instrument to kind of scrape the nose.
Yes.
Um, how long ago was that when Michelle did that to me?
Years
Like
ago.
3 years ago, maybe,
Yeah.
right? So about 3 years ago, like a friend of ours who does facials, she did a facial on me and she scraped my nose. My sinuses haven't been that good in so long.
Hmm.
Like they weren't horrible, but like when she scraped the nose, I was like, oh, that's interesting. My sinuses opened up and have stayed open. Yeah.
Yeah, because there's so much, and that's the thing.
Yeah,
There's so much
it
going
gets
on in
so
that
impacted
area.
on the nose. Yeah, it's so
Mm-hmm.
impacted.
Yeah.
Yeah.
And even doing like other scrubs that are more gentle, it's still like sometimes it needs more.
Sometimes it's too impacted. You know,
Yes.
because I'd done all those things, and you know,
Mm-hmm.
even make like little special like scrubs for the face and everything, and it helps. But when she got in there and like just pushed that stuff out,
Yes.
it was a game changer. Like there was
Mm-hmm.
a tension in my face that was not there anymore.
Mm-hmm. Yeah. Makes sense. Okay, perfect. Thank you. So that was the short one that, yeah.
Mhm.
So the other thing is, it's kind of weird because I'm like, okay, if we're talking about the kidneys, so all of these things, some of the stuff you mentioned, I remembered from before, the cordyceps and all the
Mhm.
other things. It kind of makes sense because you want to stimulate movement. So I've been treating somebody who's like stage 4 chronic kidney disease. So
Yeah,
it's like
yeah,
now, in addition to it being, not great, there's multiple issues. There's an issue with the liver, there's an issue with the gallbladder, stones, anemia due to the kidneys. He also has anxiety. There's also some trauma from a very young age. In addition to all of that, the person doesn't want to take anything at all. So not even like pharmaceutical stuff. So not even really going to see a doctor to take care of the gallbladder. I've been doing some healings. There was some response, but I mean, realistically, the body is in such a shape that it needs something deeper. So let's say I don't know, unless I'm missing something and there's another miracle that can move things around. Another thing that's related to that is there's a restless leg syndrome.
Mhm.
the and the person didn't approach me for healing. It's a relative of that person. So what I was told is that the restless leg syndrome is due to the anxiety. But what I'm wondering is, even if
I don't know about that. I don't know about that. That's accurate.
that's why, and even if I'm breaking down, because to me, you know, so yeah, the neck pain, that was an easy one. Like, so to me, something like the restless leg syndrome, I'm like, okay, let's break stuff down. I don't think it's anxiety related. I think it's something else, but I'm not sure.
It can be blockages in the legs, but most likely restless leg syndrome is a basal ganglia issue, and it's usually tied to some form of like potential, like the things that are associated with anemia. So it's like B12, folic acid, iron, like there's some sort of deficiency, and it's usually a substantial deficiency in those areas.
Okay, which is why I couldn't make nothing like, and I treated, because when I treated some of the emotional stuff, there was a slight change, and I'm like, oh, so it's kind of, you know, so there's some shifts, but
honestly, I would set all the symptoms aside. I would drill down on that solar plexus. That's what I would do, because you have somebody who's not really wanting to make any sort of effort or change to feel better, to heal. You know, whatever reasons that they have, it's still so you got to generate the movement, and like either they're going to get better or they're not. So I'd forget chasing the symptoms, because
that's why because when I started working on the person, I did mainly, you know, the emotional stuff. There was a little bit of a change, and the relative who wants me to do it wants to see change immediately, and I'm like, this doesn't really work like that.
They're not participating, so it's not going to happen.
No. Also, there's some cognitive issues here. That's okay. So thank you for that. Now let's say the person would have been.
This is what I would say. Like, sometimes it took me a long time to realize this. Not everybody wants to get better.
Yeah. And,
and most people do. Most people do. But there's still people sometimes that don't want to get better, and your time and energy spent better doing other things.
Exactly. And which is why but for me, and I was kind of debating if I should even bring it up, but for me, I really wanted to understand, like, I like to know that I can troubleshoot things. But really, if we're talking about stage 4, let's say the person would have been open to doing something, would the oils and the cordyceps, all of that.
I wouldn't use oils. I wouldn't use oils because that's probably too hard on stage 4 kidneys.
Yeah.
Well, I would use cordyceps.
You would use cordyceps. Okay. And then just keep getting the body into a better state.
Yeah.
Okay. So thank you. That, and the restless leg syndrome was like, I need to like get that idea. Okay. So thank you. And then, well, that's kind of related, but not, it is somewhat related, but going back really to energy, we talk a lot about the Ming Ming and how it's related to the kidneys, to the movement in the body, to the brain. But we talk more about what happens when it's overactivated and when it's congested. But then when it's depleted, then, because like even on this guy, which I thought was kind of interesting, it to me, unless I was off, it felt like the Ming Ming was depleted.
That can happen.
And so that would be what the systems are not like, how would you
most likely it's the kidney issue is what's probably depleting that.
Okay.
Yeah.
Okay. That was my train of thought, but there was so many things that were off, and sometimes I'm like, okay, I need to like make sure. Okay.
I mean, if you're still going to do therapy on them, I would just focus on the solar plexus and maybe the arms and legs. I disregard all the symptoms because like that person is in a highly degenerative state.
Yeah.
So I just, open up the potential for there's some sort of movement. And if not, you tried.
Okay. Yes. Thank you so much.
Yeah.
And then actually one other question, again, that's like a severe thing. I'm not even treating the person, but what would you do with somebody who has like a severe ulcer? The person is like coughing blood.
Yeah, I
emergency
would give them
situation?
slippery elm. Slippery elm.
And what does internally or?
Yeah, slippery elm is an herb, and I would have them make tea or take capsules, whatever it might be, of a slippery elm. Like, you know, slippery elm, like sometimes when people have ulcers so bad, they can't even keep water down, but they'll be able to keep down slippery elm tea. And so it's very soothing. It helps the ulcer to heal, and it will help them to hydrate the body. And, you know, it over a period of time, it's very, very good for ulcers.
So then, and if there's like really a case of like anemia over there and a bunch of other, like the ulcer is so bad that they're not even sure what's going on. So basically starting to take that would start diminishing the size of,
Mhm. Yeah,
okay. And
Yeah.
then how many times a day would you do that?
five or six times a day. Like you
Okay.
could eat slippery elm as food if you needed to. Like, you
Oh,
know,
wow. Okay.
slippery elm, like a lot of times you double boil it, like when you're making a tea. Most
Okay.
people don't, but like in the old days, we would double boil it. And then, you know, you would pour off the tea, but then there's like this powdery stuff, and you can actually eat it like oatmeal or cream of wheat.
Oh, okay. Yeah,
Yeah.
and that person would, if they would be open to anything, it would be to something like that. Okay.
Yeah, yeah.
Perfect. Thank you so much.
Yeah,
Thank
you're
you.
so welcome.
I think we're at a good pause point. One more question,
Sure.
because I missed it earlier. Okay, looks like there's a few questions. Okay. But let's stick with the slippery. Okay. Is Sweet Annie the same as sweet wormwood?
No.
Slippery elm can also be massaged into the stomach topically or massage it into the skin for the elderly. Oh, Zacchaeus letting us
Oh,
know.
okay. Yeah, I didn't know that. Yeah. Okay.
And then someone's asking, does slippery elm heal gastritis?
Usually for that I would use yarrow. It would be helpful, but I would use yarrow.
And did Greg say one time that birch complex anywhere on the body can reduce pain in
Yeah.
other areas?
Yeah, exactly. Yeah, good recall. Yeah.
So we take a little bit of a
Okay, how about we'll take a break and we'll come back at 20 till the hour. Hey, everybody. So I'm glad to keep asking, answering questions. So feel free to do that. But I'm also going to just keep talking about some of these different pain syndromes and issues. But you know, ask whatever you'd like. So next we're talking about nociceptive pain. And this is what most people call pain. This is the most common form of pain. And it's usually dull, achy pain. And, you know, here we kind of laid out some issues with this kind of pain. But just think of it as dull, achy pain. You know, it's not sharp, it's not stabbing, it's not radiating. It's just like, ugh, my shoulder feels blah. My shoulder feels, you know, achy. It feels weird when I move it, you know, those kinds of things. So most times this is tied to stagnation, stagnant lymph, stagnant movement of blood. You're not getting healthy nutrients to that area. A lot of times these can be chronic areas over a period of time. And so again, let's talk about approaches to addressing this. First thing out of the ORIC program, again, respiratory system. So you're wanting to work the respiratory system in the aura so that the respiratory system starts functioning better and starts helping to pump the blood and lymph in these areas. And it also decreases body tension. The vibrational state would be balancing the autonomic nervous system using lemongrass. And a lot of times we would put lemongrass on topically in the body. But if you wanted, you could also use the lemongrass tincture in internally, like be it either the tincture or a few drops of the essential oil taken internally. But then if you jump to just treating that area, you want to stimulate lymphatic function. And The stimulation of lymphatic function, can be the lymphatic blend, or you could use something like bay laurel. Bay laurel, sometimes I'll take internally for this particular thing, but a lot of times I'll use bay laurel or angelica seed or helichrysum and a body tonic. You could also use lymphatic blend or chakra root cleanser. You on the body tonic, you rub it in the area, and a lot of times just that makes things start feeling better. But what I like to do is use a body tonic, apply it to the area, let it dry, and then cover it with an ointment, and the ointment being just the basic pain relief. So pain relief, it has a bunch of birch tar in it. It has things that are lymphatic stimulants, so it helps move the lymph out of that area, and a lot of times that will help to resolve the pain. So again, it's dull, achy pain. Like things just don't feel that great. Like, you don't have that sharp stabbing pain, you have dull achiness. Then we drop down to neuropathic pain. So this is the sharp pain, the stabbing pain, the pain that radiates, right? So you might feel tingling in an area, it will radiate to an area. You feel like electrical little impulses that go through. Now, sometimes they can be combined, but nerve pain is a nerve is being compressed or pinched or compromised somewhere. Like a lot of times it's in the spine, or tissue will compress it. Sometimes there's inflammation in the nerve, but again, more so than anything, here you really want to treat respiratory function. So again, respiratory support or pulmonary stress support for this aspect. And we keep talking about them, but like I'd like to maybe even go through and treat this one a little bit. Even if you don't have it, it still feels really good on the body. So I know that not everybody's going to have respiratory support or pulmonary stress support, but if you have like larch, or if you have hyssop, you have frankincense, sitka, anula, ame visnaga, it's not a replacement for these blends, but you'll still get the idea.
I missed a lot of those.
So
we got
hyssop,
larch,
spruce,
hyssop, frankincense, so spruce, okay,
sitka,
sitka,
German chamomile.
okay. Okay, let's see if they have those. I think one of those are at least in the kit, right?
I think so.
And then otherwise, if they do the respiratory support or
Yeah.
the pulmonary stress support, those would be
Yeah.
the top choice.
Yeah, if you have the ORIC programming kit, pull out your pulmonary stress support. If you don't, try one of those single oils. And before we get rolling, just notice how the body feels. Move the body around, move the spine around. So you have whatever oils you're going to use. Begin inhaling, and we're going to do the quadrants of the aura. So you're doing the whole left side of the body, left side of the face and neck, the left shoulder, down the ribs, down the outer part of the leg, all the way down to the ankle. Your awareness is on the left side of the body, and you're taking nice, long, slow, deep breaths. Now move your awareness to the front side of your body, your face, throat, chest, abdomen, down the fronts of your legs, all the way down to the tops of your feet. And then the right side of your body. From the right side of your face, down the whole right side of your body, down to the right ankle, the outer ankle. And then the back side of the body. Back of the head, neck, down the whole back, the hips, down the back of the legs to the heels. Then just pause and be still. Notice how your body feels. Sometimes I like to just open up the lungs a little bit more. So with that same oil that you're using, or if you had like some form of eucalyptus, pull out your eucalyptus and just take some long, slow, deep breaths with your awareness just on your lungs. Just open up your lungs a little bit.
So. What, I'm sorry.
You can use the same oil or you can pull out eucalyptus. Yeah. So you can use the same oil you were using, but if you had some eucalyptus, eucalyptus helps with the expansion of the lungs. And then just pause for a second. And then again, nice, long, slow, deep breaths. Okay. So next we want to address the vibrational state of the body. So pull something out, like if you had the class last weekend, pull out a lei. If you don't have that, use something like tarragon or lemongrass or lavender, marjoram, melissa. Let's start with that and see if we need more.
Were any of those choices in the kit?
Lemongrass ones,
Okay, that's right. So I have lemongrass, lavender, melissa,
tarragon,
tarragon,
marjoram.
marjoram. Okay.
Marjoram was in the kit too.
Oh, right, great.
Big bottle of marjoram.
Yeah.
And so, like, if you have marjoram, for example, I'd use marjoram, put it on the shoulder areas where the neck and shoulder meet. It takes some tension out of your body just right there.
And delay. Would it do that too or no? Probably not.
Probably if you had a lay, like maybe just put a drop on the breastbone. Okay, so we're going to do the quadrants again. Or we're going to do the quadrants again, but this time we're using a different oil. So left side of your body, from the side of your face, all the way down to the left outer ankle. Nice, long, slow, deep breaths. Down the front side of the body. Your awareness is on the front side of the body. From your face, down the front side of the body, all the way down to the tops of your feet. the right side of the body. Your awareness is on the whole right side. Right side of your face, down the body to the right outer ankle. And then the back side of the body. Down the whole back side. And then when you get done, just pause and be still. How's your body feel?
More relaxed. And there's certain tension spots that are releasing feeling.
So Samantha was saying that her body feels more relaxed, and you felt relaxed already, right? It wasn't, but there's like areas of tension that feel like they're continually like unwinding or releasing. So that's the idea. Like if you had health rays, you would work that health rays, as it's listed there, but work with what you have. And here we go into bronchial spasms, and this is even like a little bit of a shortened version of it. Like sometimes I just try to hit the key spots rather than having this big involved process. So again, the oils that are for respiratory function, Ami Visnaga, frankincense, German chamomile, hyssop decumbens and hyssop, anula, larch, sitka, breathe easy, bronchial blend, whatever you have. Whatever you have, Begin inhaling, your awareness is on your throat. Nice, long, slow, deep breaths with your awareness on your throat. You're taking nice, long, slow, deep breaths with your awareness on your throat. Drop down to your throat minor, that little notch, the base of your throat, the throat minor. And just pause for a moment. Keep the bottle in your hand, but just pause. Let's do that one more time. Your awareness is on your throat. You're taking nice, long, slow, deep breaths. And then go down to the bottom of the throat or the throat minor. Your awareness is on that throat minor, the bottom of your throat. You're taking nice, long, slow, deep breaths. And then just pause and be still. Now check in with your body. Like Samantha was saying, she could feel her body relax and she was feeling areas release. A lot of times with nerve pain, there's tension being held, especially in the spine or somewhere in a neural pathway, right? So we're wanting to open these things up, or wanting to release them, or wanting to relax them. You know, even if you're feeling like pain radiating down the arms, it's most likely coming from the neck or from the shoulder. You know, if you're feeling it in your hips or in your low back, it's coming, you know, from the back, the hip, and then radiating down into the legs. And so if you had the pain relief neuropathic, you would then put this in a particular area. If you had peppermint or corn mint, that would also go into an area. Most likely, ointment would be best application. Every once in a while, you could put it in like a neat application, but the mint is kind of stimulating. So I like the idea of putting it in an ointment. Now, what you could also do is put like a lemongrass body tonic over the top of it. And so I know the kit for purchase, isn't there a lemongrass body tonic in there? So the ones who have a body tonic like that, shake it up and put it on one of your areas. You know, even if it's dull pain, still, let's just try. Let's see how it goes. So shake up the body tonic and then put it on one of your areas. So this will help to relax that area, right?
So the body tonics in the kit are spagyric wintergreen or spagyric lovage.
Oh, use the spagyric wintergreen. So you're going to take the spagyric wintergreen, shake it up, rub it on your area. If you have another body tonic that's like relaxing or something like that, you could use that as well. And then, you know, if you have the pain relief neuropathic, use that. If you don't, in the kit for purchase, use nerve help. Pull out the nerve help, and just in a neat application on that area after it dries, put a few drops and just rub it into that area. So first you do the body tonic, and then you can either do a neat application or an ointment. And then after that, how does your body feel? We're going to talk about some more, but let's go ahead and share experiences, ask questions. You can unmute yourself, type in.
Dan, your hand's been raised.
Hey, Dan.
Hey, yeah, I've been really liking this is from the lymphatic clearing thing, going from the marjoram to there's white cypress in the kit. I'm just about done with the white cypress.
Yeah, you can fly through the cypress pretty good.
I just flew right through
Any
that.
sort of cypress will work, but white cypress is a thing I use in blends. I don't even know if we have it on the site, but
No, I just
like,
checked because I was going to get some.
yeah.
But so any cypress will work then?
Yeah, regular cypress or the white cypress would work. They're very astringent, and so they're about even. And I figured people might already have regular cypress, so I thought I'd just make it a little fancy and
Yeah,
something
yeah.
you guys don't have. But
It was a real interesting feeling because I worked with this yesterday too, you know. After one arm, I went to sleep. So, and then my legs, and then woke up for the abdomen piece, and then did that, and then my legs were really hurting last night. But you had done the legs, but I fell asleep through that one.
Yeah.
So I did the legs today, actually. So it's like, it's really an interesting cleanse, actually. It really
Yeah.
feels
Oh, yeah.
like a real cleansing, like inside cleanse kind of thing.
Yeah.
It really is kind of an interesting feeling.
Yeah. Yeah, it definitely starts to open up the blockages and gets energy moving into that area. And your body starts to go into that repair mode. So,
Yeah.
the byproduct of that is you go nighty night, like, and you conk out. After we did our class last night, I was doing something. I go, I'm gonna do a little bit on me. And I took like probably hour and a half nap. I was just out. And then I woke up and I was like, okay, I'm ready for bed now. It's just, I don't know, it was good repair time for the body.
Yeah. Yeah. Really good. Okay. Thank you so much.
Yeah, you're so welcome.
Yeah, I think you might have knocked people out after all that. I don't know.
Yeah, like you can see that a lot of the work on this one is like the aura and the breath. And then you go and you treat the site. And if you really work those components, the body responds by reducing, the tension in the area, and the pain becomes much easier to manage. So you're treating the aura, right? You're treating the auric program. So think of the auric program as the potential in the body, right? Then you're going to the vibrational state, and is the body repairing or degenerating? So you're trying to push it into more repair mode. Then the third thing is usually there's some sort of issue that condition might have, right? And then you go to the condition itself. So, I'm trying to keep it simple. In the old days, there might be like 8 or 9 different things you could do. I tried to boil it down to like 3 or 4. Most times it's 4. And it's a way to kind of systematically treat it from an energetic point of view, from the state of the body or the vibrational state of the body, addressing some correlated issue or problem with that area, and then the area itself. So you're kind of getting the full spectrum of how to treat it: energetic, vibrational state, secondary issue, and then the symptom itself. And so you have a greater potential for success when you address those things, you know. So anyway.
Oh, I love that.
So if nobody has more questions, I'm gonna jump into arthritis.
Okay, go ahead.
No more questions? Okay. So we are on the bottom or the mid-page 32. And we're looking at degenerative pain, which basically means arthritis. Degenerative pain is like when an area is breaking down. So a lot of times arthritis is, a thinning of cartilage, a disc, a joint is not functioning like it should. Bursa sacs aren't functioning like they should, so you're not getting lubrication in the joints. There's spasms in and around the joint. The joint has been injured for a period of time. Anytime there's been spasms in the body around a joint, 10 years, 20 years down the line, that starts to turn into arthritis. So you want to be able to reduce spasms in the body the best that you can, because eventually it's going to cause a degenerative condition in a particular area. But arthritis happens for all kinds of reasons. So it's not just because you had some spasms in the area. Spasms are one of the ways. But here again, the auric program component is the lymphatic system. So we're wanting to stimulate lymphatic movement in the body. We want to stimulate lymphatic potential in the body. We want the joints to be able to detoxify. Like in the old days, before there was pharmaceuticals and everything, like if you had a bone-on-bone hip, in 1850, there was no surgery. Like you were either bedridden or you just didn't function anymore. And hip issues back then were very common because of people riding horses or getting thrown from horses or bouncing around on a stagecoach, right? It had no shock absorbers in it. It was just like you would just bounce around. So they would, beat the crap out of their hip sockets sitting on these stagecoaches. So when you go back and you look at the the medical books of that day, almost everything was about the hip socket. Like it was, there was one osteopathic book that I looked at that they would even look at contagious conditions like the flu and things like that. The first thing they would address would be the hip socket, which I kind of get, but I kind of don't. But I think it was more of because of the time, people had a lot of hip related issues because of riding horses and stagecoaches and getting thrown from a horse. And so when the hip was out, right, at first it causes a lymphatic issue in that area, but at some point it becomes systemic, right? And so it makes you really prone to be sick. So in that way, I kind of like got it. Like they would look at the head of the femur and make sure that it was in place. But basically any sort of arthritic condition, you want to stimulate lymphatic movement. So here we have the lymphatic blend to start it off. And then from there we go to the trigger point blend, which again is helping the body go into to diminish the catabolic state and increase the anabolic state, which basically just means your body goes into repair mode. And then from there, we do the energy flow, right? So energy flow for this particular kind of condition is very important. So let's say we're doing the hips or the knees. Actually, let's just do it. Instead of talking about it, let's just do it. So if you have lymphatic blend, let's pull that out. If you don't, try using bay laurel. If you don't have that, helichrysum, even chakra root cleanser would work, or helichrysum, chakra root cleanser, even eucalyptus would work. Okay. So you have something there. Like if you didn't have those, even cedar would work. Okay, so again, left side of your body from the side of your face all the way down your left side. So side of your face down to the ankle. Nice, long, slow, deep breaths. Still on the left side of the body, you're taking nice, long, slow, deep breaths. Okay. And move to the front side of the body. Your awareness is on the front side. The right side of the body, the whole right side. From the side of your face, down the whole right side to the outer ankle. And then the back side of the body. Awareness is on the whole back side of the body. Awareness is on the back side of the body. You're taking nice, long, slow, deep breaths. And then just be still. So here you've opened up the potential for greater lymphatic function. Now let's look at the state of the body. We want to move it into rest and repair. We want to shove it into repair mode in this particular area of the body. So normally we'd use trigger point blend, but here, if you have trigger point blend, use it. But if not, pull out like ginger or cedar.
The kid
Ginger.
is in, okay, good.
Yeah. Yeah, ginger would work. So you have one of the oils and begin inhaling with your awareness on the brain. Everybody's good. Nobody needs a sub. Now your awareness is on the spine. The brain and the spine at the same time. How's this feeling? Yeah, I always like this. And then the brain and the soles of the feet. And then just pause. Now, let's pretend that you have arthritis like in the hips or in the knees, right? Common area to have arthritis, especially osteoarthritis, which is just means the cartilage is broken down, right? So with that, we're going to pull out our mugwort and we're going to do the energy flow technique, but it's for the legs. So pull out your mugwort or artemisia. And here we're doing the quadrants, but only from the hips down. We want to flood the legs with prana, with energy. So this is the way to get energy moving in the legs, including the feet. One of the areas where arthritis will happen in the feet is on the heels. So you have your mugwort, and that's again start on the left-hand side of the body, but from the top of the hips down to the ankle and the bottom of the left foot. So you're using mugwort on that left side all the way down. Then move to the front side of your body, from the tops of your hips all the way down to the bottom of both of your feet. Then the right side of the body, top of the hips all the way down to the bottom of the right foot. And the backside. Your awareness is on the backside from the top of the hips all the way down to the bottom of both of your feet. And then just pause. Now, we've gone through and we've opened up the flow of energy down into the hips, the legs. Now, if you had joint relief, you could put joint relief onto the affected area. How about for the ones who have the kit for purchase, pull out the pain soothe. And even if you don't have issues in the hip or the knee or the ankle, put it on one side, put it on a knee or an ankle or a hip, and then compare the two. Pain soothe is a great general pain reliever that kind of hits all the different ones. It's not super specific, but it hits a lot of, if in doubt, you go to pain soothe. If you have chronic pain, you go to nerve help.
Someone's actually asking nerve help too, and then she's laughing because
Yeah. Like, because the thing with nerve help is when the body gets into a chronic pain syndrome, like the nerves get used to being in that syndrome. And so you keep trying to change it and break out of the pain cycle. And the body is like, no, this is what we do. Like we've been doing it for years. Right. And then you're like, but I'm kind of sick of it. And the body is like, well, this is what we do. The nerve help helps to re-educate the nerves to break you out of that pain cycle. That's the way my body talks to me. We've been doing this for years. Yeah. But if you had like an arthritic knee or you had an arthritic hip, the joint relief for like an arthritic hip, man, worth its weight in gold. That's one of the first things that I made it for was treating arthritic hips where they were getting close to bone on bone or, was going down that vein, or even if they were bone on bone, that's what we would use. So once you put it on the area, notice how that area feels. Because like the thing is like if you go like, well, I don't really have any pain or I don't really have anything, but your body could still feel better. You might not feel like, oh, the pain's there. You treat one side and you go, yeah, this side feels great. Now this pain hurts. It's because you got used to it. Like it's achy
It's always been achy, but you don't have anything to compare it to. And that achiness wears on the body, wears on the emotions, wears on the mind. Like it's pain has a very profound effect on the body. And you get used to it, but the more that you diminish it, the more that the body is able to shift into rest and repair and action and sleep and not have anxiety. And some anxieties are actually because there's areas in the body degenerating or there's pain syndromes. So the next piece, spurs, deposits, and joint toxicity. This is going even a little bit deeper into arthritic conditions where you're dealing with spurring, like deposits in the joint, right? And so, there's a kind of an explanation, and again, lymphatic blend, again, trigger point blend. Then you do things to reduce the effects of the spurring in the joint. On number 3, symptoms, you would apply like Arthricare or Eucalyptus citrodora. Lovage works really well for this. Both the Eucalyptus citrodora and lovage leaf or root are a big component in Arthricare, and it's all about detoxifying the tissue. So one of the things that if you have some lovage or Eucalyptus citrodora, or the ones that have the kit, you have a body tonic of lovage, shake it up, like check your shoulders out and just rub it on one of your shoulders. Just shake the body tonic up. If you have lovage leaf as an essential oil, put like 3 or 4 drops in and rub it into the area. It detoxifies the tissue, it detoxifies the fascia. It feels very nice. Very, very nice. So just give that a shot.
So we have the lovage body tonic or lovage, and what was the other option?
Eucalyptus citrodora or Arthricare. And then the ones that applied something like the lovage or Eucalyptus citrodora to the body, notice how that feels. So kind of interesting, the different kinds of pain. And there's still a bunch that we haven't talked about, but this booklet's more like a cookbook than it is about we're going blow by blow. But I want to drop down to emotional pain. So it's at the top of page 44. Now, here's the thing with emotional pain. There's emotional pain, there's a thing for unconscious pain, which is things that are not in our awareness, but they're still down deep and causing us discomfort or pain. And then there's even social pain. And pain, regardless that it's in the body and the emotions and the mind and social interactions, which would be tied to instinctive responses, still hits the body the same way. Like, even though you might not have a physical ache or pain, you might have an emotional ache or pain, still hits a lot of the same physiology in your body. You have social anxiety and you go out and you do things and it's like very uncomfortable, still hits the body in the same way, right? You have unconscious pain that you're unaware of, but different little triggers might hit you in situations, still hits the body in the same way. So I wrote things out so you could go through and treat it. It's not a kind of pain that people talk about very much. We treat it as like, oh, it's an emotion, it's this, it's that, it's a situation that has a story, but still there is a pain component to it, right? And so a lot of times, just like in the body, if we're in a degenerative state in that area, then it's harder to heal that particular issue, right? So this is a way to go through and help yourself process and release things, right? So in this, the auric component of it is mind, right? Mind. So this helps to stimulate mental processing. Even though we're talking about emotional states, it still helps the body, the emotions, the mind go through and process. When you feel something, it stimulates a thought. When you think something, it stimulates an emotion. So they're very intertwined, right? So I don't know. I think we could squeeze this in. I kind of want to.
Let's put it go.
Okay. So mind. Let's find some. I need to find substitutes. If you have the auric programming class, pull out mind. If you don't, I'm going to find you a substitute here real quick. Give me just a second here. I have so many recipe books. I have to. Hmm. So substitutes for mind would be like cistus, spikenard or valerian. Poplar balsam would be another one. But also we could use eucalyptus or cypress. Yeah. So just notice your emotional state. Notice your mind before we start rolling on this. I find this one in the unconscious so interesting. Okay, so you're doing the quadrant, the left side of the body, from the side of your head all the way down to your ankle. The left side, long, slow, deep breaths. You're still on the left side of the body. You're taking nice, long, slow, deep breaths. Then the front side of the body. The right side of the body. The whole right side of the body. Side of your face, all the way down the side of the body to the ankle. The back side of the body. Awareness is on the backside of the body. And just pause and be still. So this next piece, we're working the state of the body from the point of view of energy. So we're looking at bringing in light. You're bringing in light to the elements or the elementals. So if you have the harnessing the light blend from last weekend, use that. And if not, use either frankincense, myrrh, frankincense and myrrh together. You could use neroli. You could also use angelica or angelica seed. Oh, um, let's go. And the kid, I'd say from the kit, let's have you use nerve help. Because again, like part of what you're doing with bringing in the light is you're breaking an energetic pattern. Nerve help is about breaking the pattern in the body. So it should overlap a little bit. So you have your oil. Is everybody good? Or begin inhaling. Your awareness is on the lungs. Yeah. Your awareness is on the lungs. You're doing nice, long, slow, deep breaths. The liver on the right hand side below the ribs. A gallbladder, so your midline, 2 inches off to the right, below the ribs. Midline, 2 inches to the right, below the ribs. Your kidneys, your awareness is on the kidneys. And then the spleen, left-hand side below your ribs. Your awareness is on your spleen. You're taking nice, long, slow, deep breaths. Move your awareness to the sex chakra. Your awareness is on the sex chakra. You're taking nice, long, slow, deep breaths. And then just be still. Just be still. Now, we're going to do the etheric hygiene, jumpstart the lymphatic system from the techniques. So there's a big list: black cumin, frankincense, ginger. If you have the kit for purchase, ginger is in that kit. But helichrysum, impapo, turmeric. Then blends are anabolic state, trigger point blend, fascial release, or helichrysum supreme. So pick one of those out. Then begin inhaling with your awareness on the throat. You're taking nice, long, slow, deep breaths with your awareness on the throat. Your awareness is on the front solar plexus. Your back solar plexus. Your mid back area. How's this feeling back? So good, huh? You know, even though we're doing like a physical thing here, we're jump starting the lymphatic system, a lot of our emotions are generated by the body. So if you calm the body down, if you take it out of degenerative state, the emotions change. You know, the emotions are being generated to help you to thrive in the environment. Your awareness is on the spine. You're taking nice, long, slow, deep breaths. And then just pause and let go. So the last aspect of this is transmutation. So the blend sadness and grief works. The single oil ginger lily works, but you also have like some very solid B choices. The blend sadness and grief is rose, but it also has marjoram and cypress. So you have marjoram and cypress in the for purchase kit, and we have marjoram in like a lots of kits. So I'd say if you have one of those two, let's pull that out. So if you have ginger lily, use that. If you have sadness and grief, use that. If you have rose, you can use that. Um, mm, kind of, but I prefer the other choice. Yeah. Okay. So I think everybody's got something. So your awareness is on the sex chakra. Nice, long, slow, deep breaths. Awareness is on the sex chakra. You're taking nice, long, slow, deep breaths. Now, move your awareness up to the temples. So your awareness is up on the temples. And then your awareness is on the sex chakra and temples at the same time. And then just be still. Just be still. How did that feel? Like, notice how you feel. Think of something that might normally bother you and just check in to see how it feels. What do you know? Yeah, there's like kind of like you can look at it and you're just like, eh. You know, you took the pain out of the situation. Now, granted, sometimes certain situations you might need to do it more than just once, but still you get the idea. So let's go ahead and open up to shares and questions. Keep in mind, we are going to be doing a study group on Wednesday, and we're going to be posting these things in smaller sections and segments on the site, on the website. So anyway.
Someone's asking, am I supposed to be getting hot after that process? Go ahead, Lolly.
Hey, Lolly.
Hey.
Hey.
That
How'd you do?
was, oh my God, the whole thing was really cool. Like really the combination of everything in this section, and see how it all combines. But oh my God, the last thing with the ginger lily, that was just, I don't remember that we've even done like the sex chakra and the temples before.
No. That's an excerpt out of the class in November.
Okay.
Yeah. Like the plant teachers, like different plants have like different they have like different like ideas that they kind of treat. And so we're going to be working different plants with that kind of pattern. You know, there's a little bit of a setup for it, but yeah.
So yeah, it was already starting to feel like everything, the body was really relaxing, but this thing really like not, yeah, so that was quite amazing. Okay, so I guess we'll go over the details when we have the class. And then so just a quick question, the health raise, is there anything that would be, so I remember you mentioned it's either like doing either inhaling the oil or putting it on the wrists or doing a spray. Any benefit in doing it as a salt scrub?
Yeah, sure. Oh yeah.
Okay.
Yeah.
So
I
kind of
would open up the health raise. Yeah, that would be a great way to do it.
right.
Yeah.
Okay, so alternating that with all my other ones. Okay, I'll email you guys about that. Okay, I was just wondering. Perfect. Thank you. Because I work a lot with the chakra root cleanser, with the body scrub. I also have like the green healer, but still the health raise would give me something more for the health raise. Okay.
Yeah.
Okay, cool. Thank you.
You're so welcome.
So for the arthritis, does that include osteoarthritis or put it with some other immune group like rheumatoid arthritis?
It would work for both rheumatoid and osteoarthritis. The one where it might not work super great for is psoriatic arthritis, which is arthritis associated with psoriasis. With that one, I would treat it as an inflammatory condition, but that one's a little bit harder to treat. Sometimes there's also a digestive component to the psoriatic arthritis. So I didn't address that here because it's a little bit more complicated, and I will make some notes for that, but it's any form of arthritis would work. Yeah.
Okay. Osteopsoriasis. I think that's kind of what it looks like. Osteoporosis. Is that not a word? am I reading it wrong?
Um, what are they?
Osteoporosis.
Oh, osteoporosis is like a precursor to. Let me get up a thing here. Let me look at my notes. Yeah. Usually for osteoporosis, the best thing you can do, I mean, you can try treating things topically. If there's pain, you can treat it like probably like inflammatory pain. But the best thing for that would be weight bearing exercise. You know, it doesn't have to be very heavy, but weight bearing exercise is the best thing to do for that. Yeah, better than any supplement, better than any oil, better than anything. Just, you know, little 2 pound, 5 pound weights and just, you know, working the body out is super helpful for that.
Thank you. Are there any single oils that can be used in place of the Health Rays blend?
Sure. Helichrysum could be used there. Sandalwood could be used there. We were talking about Sweet Annie. Sweet Annie could be used there. There's some other choices. I have to look them up. I can't recall them right now. Give me just a sec here. Straw flower, galbanum, Litsea cubeba, lemongrass, basil, clary sage, lavender, or Roman chamomile.
That's a lot of great options. Huh. Great. Can emotional pain be used for folks who have or have begun to lose hope?
Yeah. Oh, yeah. You know, the thing when people start to lose hope is, you know, yes, there's some emotional pain there, but that's also a very depleted spleen. The spleen, when it's depleted, it's like almost like you don't have the emotions to feel. And so the heart starts to like shrink. It's not because the person's not a good person or something. It's just the heart doesn't have the energy that it needs to be activated. And so things like I like to use Angelica for stuff like that, but things that are strengthening some time, especially the softer forms of time, like time linalool, time geranol, time Thuyanol, that can be helpful. Sometimes cinnamon can be helpful. I like to use Angelica though, Angelica or Angelica seed. I usually use Angelica seed for that.
And then what's the application?
Angelica or Angelica seed would be internal, thymes would be internal, cinnamon would be internal. Yeah, pretty much everything would be internal, like a few drops. St. John's wort can also be effective in a tincture or essential oil. And also that would be internal. Rose could be another one, actually. Rose or ambrit can also be used for that. Yeah.
And then go ahead, Teresa.
Hey, Teresa.
Hi, Greg. Yeah, what was I going to say? A couple of things. That was really great. And it feels like my sacrum wants to get filled up with something, you know, so there was a lot of shifting, but I feel like it wants to draw in some kind of energy. Would you make any recommendation in terms of an oil?
Like what do you mean? It just needs something.
Yeah, I can feel like it trying to draw in something. And I was just curious what might be helpful to like imagine there was a clear out and it wants to fill back up, but with something light.
I would do galbanum.
Okay, internal or topical
Either
or
way, either way.
or just inhaling.
I would probably do either internal or topical. Like you could augment it with inhaling, but internal or topical.
Okay, great.
Yeah.
That's wonderful.
Yeah.
Oh, and just following up for last weekend, so the puppy is on his way. I will get him on Friday.
Oh,
I
yay.
sent
Yay.
Samantha his photo.
Oh, yeah. I'll get to see Jared.
He's my screensaver now too.
Yeah.
Is he? He's gorgeous. So
So
thank you.
Yeah.
So you guys have to come to Seattle now.
Oh, yeah.
Thank you. Thanks for the great class.
Yeah, you're so welcome.
And then go ahead, Leslie, then Lolly.
Hey, Leslie.
Hi, Greg. How are you?
I'm doing good. How about you?
Pretty good. I had a similar experience with the sacral area.
Hmm.
What I did was I relaxed. I stood really still. And as I stood still, then I can feel my body filling up. So it felt like it was filling up from the feet going up.
Oh, nice. Okay.
Yeah. But I just, something told me to don't move, to just stay real still. And as I stood real still, then I started to feel the movement everywhere.
Yeah.
And I wanted to say thank you for a great class.
Oh, you're so welcome.
It really helped a lot. Thank you.
Good. Yeah, good.
And then go ahead, Lolly.
Hey, Lolly.
Hey, so just as a follow-up, because somebody mentioned osteoporosis. So if somebody has, okay, well, a few things. Somebody who had a very severe accident and like a brain trauma, but basically right now there's an osteoporosis on the spine. She also got the spine. She has like fusions on the spine, so she got that. She's doing okay, but it's those pains that come and go. So the person has osteoporosis on the spine where the fusions are, and then a little bit on the hips. And she's doing all kinds of exercises and stuff. But really, in addition to that, would you work something like that, the protocol for arthritis?
I would treat it more like inflammatory pain. Like moving lymph and reducing inflammation in the area is how I would treat it.
And there's some issues, I think, with the nerves, because she mentioned that she wakes up in the morning, sometimes like the fingers or the hands kind of feel a little bit weird.
Yeah. I think like we're just reducing inflammation in that whole spinal area would be helpful.
Okay. Yeah. And then just
there's no magic bullet for that condition. Like there.
Yeah.
So you just try to reduce inflammation in the nerves and the spinal nerves and in the area in and around the spine, because the inflammation will start compressing nerves and things like that. And so the things that you would use to treat along the spine that are anti-inflammatory are also antispasmodic. And so it would help to open that up a little bit, because the body is going to clamp down in those areas to try to protect a compromised area. And so, I mean, it will be helpful, but it's still like bottom line, you make sure they get enough vitamin D and sun, and the hormones are balanced out as best as they can be possible. But weight bearing exercise is by far the best thing they can do.
Yeah. And it's been, the accident was a few years ago.
Yeah.
And she's taking like a bunch of different supplements and different things, but I
Yeah.
was like, oh, okay, let's just double check.
Sometimes, yeah, sometimes even some of the medications that people get put on, I've seen osteoporosis happen with people who have been on long-term pain meds and long-term prednisone. I mean, prednisone is usually the big one. You know, it's not like, oh, I used it a couple of times, but like when people have been on prednisone for years at a time, they don't quite do that like they used to. Like, you know, 20, 30 years ago, you'd see people where they'd been on prednisone for 20 years or something. And they usually get really bad osteoporosis. So, yeah.
Okay. Okay. And yeah, she's usually taking more of the natural supplements, and she's open to oils and whatever ideas, which is why I'm like, okay, let's see what else. Okay, perfect.
I mean,
Thank you.
marjoram helps blood get to the area and then
Yeah.
inflammation, but other than that, you know.
Yeah.
Yeah.
Okay. Thank you.
Yeah, you're so welcome.
A lot of tension got released. I'm feeling
very good.
lighter and relaxed and happy.
Good.
Thank you for a wonderful 2-day class.
Yeah, good.
Could the protocol to jumpstart the lymphatic system be a standalone to
Sure.
do daily?
Yeah. You totally could do that. Yeah. The techniques, you know, because that's how the technique section, they are standalones, or you can use them to augment other things you're doing. And, you know, it's kind of like building blocks. You can kind of build and mix and match your protocols with some of the techniques to enhance it. And that way you can kind of problem solve. That's why yesterday we spent a lot of time doing some of the different techniques. Is wanted you to get a feel for it so that you go, oh, I know how that feels. That I could use a little of that, you know, energy flow technique or that mugwort thing or that lymphatic stimulation thing or, you know, whatever it might be. And so, yeah.
Would walking with weights work for the osteoporosis?
The walking part, but the weights, like it's about weight bearing exercise. It's not just about exercise, it's weight bearing exercise. Yeah.
Does Arthur Care detoxify tissues and fascia, or is lovage best for this?
Yeah, no, Arthur Care would do that. Yeah. Arthur Care has a bunch of lovage and eucalyptus citrodora in it. And so that's what it's for. It's for deposits in joints and deposits in tissue. Yeah.
I'm with Lolly. That was fabulous.
Yeah.
What do you suggest for a salt bath tonight?
I don't know. Let's mix it up a little bit. Like maybe like a ginger bath or helichrysum, maybe like a eucalyptus bath, marjoram. Terebinth if you have it. Then there's the sages, you know, some form of sage, like Spanish sage. Nerve help would be good. I like to do, like when my body's not feeling good, nerve help or pain soothe as salt baths. And so they feel really good, really good. So I'd give one of those a shot.
For the depleted spleen, would Moroccan time work?
It would work. The time linalool, time thulianol, time geranol would work a little better, but it would work. It would just be a little slower.
Are there any oils that can help with kidney stones?
Kidney stones. I mean, I would go back to probably lovage. Drink a lot of fluid and use lovage. But there are some herbs. Zakia probably knows. I want to say there's gravel root, and there's another one for. I usually just did healings on those. So
So we have also somebody said marshmallow caps, and then
Yeah,
Zacchaeus said
marshmallow could be a little bit.
lithotriptic herbs.
Hmm.
And then go ahead, Cindy.
Hey,
Hey,
hey, how are you?
yes, one of the best classes. I love
Oh,
this.
good, good, good,
Uh,
good.
both weekends. I my questions centers around when we were doing the respiratory system. I specifically noticed it more with the spasms, but when we worked on the respiratory system, my lungs felt clear, but my throat was closing up, and so
Hmm.
my gut tells me it's more of an emotional thing, because it's happened in other classes as well. So would you follow up? How would you follow up with that if a physical
So like
treatment?
you feel like the hmm.
Yeah, it ends up feeling just like there's a ball in
Yeah.
my throat, and it could be because of having the cervical fusion, and it's there's just a little irritation because you move the trachea over and stuff like that. I've always noticed
Right.
something since that, but then on the other hand, having a voice has always been an issue. So I'm just feeling it's more of a,
I would try putting, do you have some terebinth?
oh yeah, I probably have almost every oil
Okay.
someplace.
I would put several drops of terebinth and then rub it on the throat, that whole throat area. And try doing that several times.
Okay.
It'll clean up the tissue. It'll help relax that area a bit, but it will also clean up any sort of thing going on there. And if there's a little bit of scar tissue, it will help break that up.
Yeah.
You could rotate it with helichrysum, but I suspect that terebinth will be the better choice.
Plus, I talk all day long,
Right.
so
Yeah,
it's
that's true.
probably just thought of that.
Yeah.
Okay. Well, that's interesting. I'll try that. Thank you.
Great class. That was
Yeah.
perfect.
Yeah. So remember, we are going to do a study group on Wednesday. So if you have questions about how to do something on yourself or about a process, write it down so we don't forget. And we'll go through and we'll talk about some of the other processes that we didn't talk about, and maybe refine how you treat a particular condition in yourself. I kind of want to do the unconscious protocol Wednesday night. Like maybe we can squeeze that one in. Yeah, the unconscious pain.
Oh, can we?
Yeah, that one's I got a
That'd
thing.
be awesome.
I think that one might be my personal favorite.
Yeah.
Yeah. So okay, you guys, thanks for a great weekend. I hope you enjoyed, and feel free to email us if you have questions, but we also will have the study group and we'll kind of go from there.